This hearing is called to order. This is the public hearing of the City Council Committee on Public Health and Human Services. The purpose of this meeting is to hear testimony on resolution number 170949. Members of the committee in attendance are Councilman Al Toggenberger, Councilman Bill Greenlee, and we expect that several other members of the committee are en route right now and will soon be joining us. And do any of the other members have opening remarks? No? Okay. I do have some remarks that I would like to make before we call the first panel to testify. And I want to start by thanking everyone for coming. Nothing is more important than our young people, and by being here today, you are signaling a commitment to our youth, especially those that are under DHS supervision, a signal that they matter. These youth, whether in temporary foster care, seeking permanent family placement, or somewhere in between, deserve the very best in city services. My question raised from the scorecard is that what we are providing? In September of 2017, DHS offered a draft report titled Evaluation of the Improving Outcomes for Children, Transformation in the Child Welfare System in Philadelphia. This report was presented to members and staff of City Council in the caucus room on September 14th, and I remember walking out of the meeting and talking with several of my colleagues regarding what was presented and feeling that the report was somewhat empty, void of the substantial information that would make it worthy of the members' valuable time. As the host of this briefing, I must admit that I was disappointed that there wasn't more offered, and I know that many of them were as well. Nonetheless, none of us doubted then or now the sincerity of the leadership or the frontline workers at DHS. This is a difficult job, to be clear. It is also not a high-paying job in dollars, but among those who do this work and who are mission-driven, it is high-paying in personal reward and inner peace. And after all, you can't put a price on stabilizing and improving a child's life. I want to say that I have a lot of concern about what has been presented in the scorecard, and we'll go into that throughout the hearing. There are a number of things that just appear to be completely problematic, inappropriate, troubling. As we read the report, as we look at the scorecard, I find that the Liberty Bell rating system was not something that should have been appropriate for something so serious, when there was a letter scoring grade in the back of this report. And so I have a lot of questions. Why was that letter scoring grade not presented in the very front? Why was this not provided? It appears as if it was sort of added to the back as a way of disguising the information. And I don't want to think that. I don't want to believe that. So please help me to understand how I could have this impression. Please help all of us to understand why it appears that 80% of the CUAs, the community umbrella agencies, according to your report, have at least one F, that 20% have 6 Ds, 30% have 5, and 20% have 4. I counted 39 Ds among 10 organizations in 9 categories. Wordsworth, where there was a sexual assault and death occurring in recent years, received a B in supervision. I just don't understand how that could be. If the grades that were given here in this report, in this scorecard, were given to a student in school, that student would be failing. They wouldn't be passing. And so when we went back and calculated all of the grades, the average should have been a 3.0, which would have represented a competency rating according to the scorecard. When you looked at all of the categories, and the number of bells that were possible to receive, again, the letter grade on an average should have been a C, which represents competency. The actual average among the 10 KUA organizations was a 2.4, which is unsatisfactory by DHS's own words. So I look forward to hearing an explanation as to how this could be, how we can maintain a system that we ourselves have graded as unsatisfactory, and particularly when we're looking at a system that is serving those who are most in need, most vulnerable, and who certainly need our time and attention. And so with that being said, I want to recognize the presence of Councilman Derek Green, who has joined us, and ask the clerk to call the first panel to testify.
Commissioner Cynthia Figueroa, Philadelphia Department of Human Services.
Good morning.
Good morning.
Please state your name for the record and begin your testimony.
Certainly. Good morning, Councilwoman Bass and members of the City Council and Public Health and Human Services Committee. I am Cynthia Figueroa, Commissioner of the City's Department of Human Services. Joining me today, later you will hear from Representative of the Community Umbrella Agency, Don Holden, who is the CEO of Turning Points. I want to thank you for the opportunity to present testimony on improving outcomes for children, Community Umbrella Agency Scorecard for fiscal year 2017. I want to personally thank you, Councilwoman Bass, for your leadership in coordinating these hearings. We're grateful to the commitment of City Council and the Public Health and Human Services Committee towards ensuring that DHS is on the right track towards improvements and a public accountability for the child welfare system. I want to indicate that we have a PowerPoint that we'll be doing in course of my testimony, so I'll refer to some of the slides as some of this information is complicated to try to digest, so we want to make sure that there's some visuals to go alongside of that. Today we've been asked to provide information on improving outcomes for children and more specifically the progress of the KUAs. As demonstrated through the scorecard, this report is part of DHS and KUA's commitment to pure transparency, partnership, and accountability. It reflects the department's dedication to working towards improving outcomes for children and families in Philadelphia. Further, it solidifies the public and private partnership of DHS and the KUAs that were fully implemented in 2015. And this maintains our focus on improving the outcomes for children in Philadelphia. Improving outcomes for children was a transformation that was created to address a multifarious system where families had multiple case managers, multiple case plans, and the services were not based in the community. Improving outcomes for children sought to simplify the process for families with clearly defining roles between county and provider staff. The goals of improving outcomes for children are more children and youth are maintained safely in their own homes and their communities. More children and youth are achieving timely reunification or permanency, a reduction in the use of congregate care, and improved child, youth, and family function. Since the implementation of IOC, the system indicators are improving. As you'll see in this slide that we show you here, 46% of children are placed with family in kin foster homes. This is compared to 32% before we implemented IOC. 57% of youth in foster care and kinship care live within 5 miles of their home of origin, compared to 46 before improving outcomes for children. In addition, 81% live within 10 miles of their home of origin. 12% of children in care live in congregate care settings. This is compared to 21.6% before improving outcomes for children. The 12% in congregate care is also below the national average. As an increase in permanency, that means that last year, 2,024 children and youth exited the system to permanent homes compared to 1,322 before improving outcomes for children. These improvements, combined with key successes of this administration, DHS's leadership stability, a full license, an independent expert confirmation of the Improving Outcomes for Children model, and recognition from the Community Oversight Board that we have met all their recommendations, has put us in a position, as in the words of the evaluators, to build on the current momentum to continue to improve the system. Since the start of Mayor Kenny's administration, we have been able to stop the increase of children entering placement. This is an important accomplishment given the huge increase in our hotline calls. The number of hotline calls has grown from 2,026 calls in 2014 to 34,248 in 2017. We anticipate that that number will rise even further in fiscal year 2018. Not surprisingly, the number of investigations completed by DHS workers has also increased from 14,968 in 2014 to 20,605 in 2017. Although we have stabilized the number of children entering placement, we continue to have challenges in other areas. First and foremost, among these challenges that we have a high rate of children in out-of-home care. To this end, we are working aggressively to decrease the number of families formally involved with child welfare. We're doing this through the addition of field screening units where DHS social workers go to the homes of families to determine if DHS services are needed. Another challenge is our need to more effectively engage and support parents and caregivers. Improving Outcomes for Children's model, CUAs are responsible for the daily case management for families accepted for services, while DHS continues to operate the 24/7 child abuse hotline, conduct investigations, identify placement, and assist with permanency for children whose parental rights have been terminated. DHS also monitors the CUAs for quality of services delivery and provides training and technical assistance. In addition, we continue and brought back in fiscal year 18, we directly contract with the foster care agencies. Throughout the life of Improving Outcomes for Children and even for DHS has reported publicly on key data indicators for child welfare. The purpose of the scorecard is different than these high-level data reports. The scorecard primarily focuses on specific case management activity that has been indicated in research to demonstrate the best indicators of success for children and families. As such, the scorecard measures how well the CUAs are achieving the goals of improving outcomes for children, working with families to provide the support services they need to ensure children are safe and in permanent homes and promote positive well-being. This is a model that is now being looked at nationally by other child welfare jurisdictions who are looking for a more rigorous way to measure provider-specific outcomes. Fully implemented in 2015, Improving Outcomes for Children just began its 4th year. Through this model, we promised families that we served would have one case manager, one plan with services in the community. There are now 6 organizations that operate CUAs in 10 geographic regions of Philadelphia. The agencies are Asociación Puertorriqueños en Marcha, Bethana, Catholic Social Services, Net Community Care, Tabor Community Partners, and Turning Points for Children. When Improving Outcomes for Children was implemented, DHS was acutely aware that we needed to enhance existing monitoring and establish the appropriate methodology to assess quality. But before it was possible to complete a thorough assessment of the CUAs, we worked with national child welfare experts from Casey Family to identify the most appropriate tool to measure CUA performance and to develop a methodology that aligned with federal and child mandates for case management practice. Out of this practice, the comprehensive case file review tool was developed. This is a research-based tool that has been rigorously reviewed to ensure it provides an accurate assessment of performance and how CUAs support families and the goals of improving outcomes for children. From this point, DHS then spent a year, starting in July of 2016, collecting data to measure and track the activities that are now part of the comprehensive case file review tool. Finally, in 2017, we released the baseline data of our first unique Improving Outcomes for Children scorecard, a provider-specific accountability tool. To develop the baseline year of the CUA scorecard, we assessed 1,979 cases. From this process, our baseline data reflected that 3 CUAs have 3 bells, while 7 have 2 bells. The intention of the scorecard is not to only assess where we are as a system, but it provides a framework for improvement. We need to know where we are in order to know where we need to be. The scorecard does just that. We are measuring the progress of the CUAs through the scorecard, which focuses on 9 evidence-based domains that reflect the best indicators for success of a child. The 9 domains are as follows: permanency, safety, assessment plans, safety, visitation, case planning, court practice, supervision, child and youth assessments, and health and education information, finance, and workforce retention. We continue to work with members of the City Council on incorporating diversity and engagement in the measurements in future scorecards. And I'd like to call to your attention, there is information that we sent in advance that thanks to the work of Councilwoman Blondell Reynolds-Brown, that we track our spend, and we also track the leadership and the minority representation, and I'm proud to say that we've made significant gains in that area. The CUA scorecard has been carefully designated to weight the domains that are lead indicators for children and families. Within each domain, there are several metrics which are weighted. Each domain includes multiple indicators, so it's not just one individual factor. It measures completion, timeliness, and quality of the key tasks that lead to best outcomes for children. There are 49 indicators included on the scorecard. CUAs are evaluated quarterly and annually on the indicators collected through administrative data, such as permanency rates and monthly and quarterly and monthly quality visitation. For each one of the domains, CUAs receive a performance rating, which is displayed as a Liberty Bell, with more bells equating to better performance. The overall bell performance of each CUA is aggregate of 9 domains. We did not go with a grading sample because not all metrics on the scorecard can be held to the same scale. We've opted for what we call which is a weighted system. It's a more accurate representation on a 5-level scale. One example of how not all metrics are measured the same on the school scorecard is a comparison of visitation and permanency. It is much more reasonable to expect that a CUA have 95% related to visitation than 95% for permanency rate, because that's work that takes a considerable amount of time to get to. While, however, we expect 95% minimum visitation as a target. The scorecard has different benchmarks for performance. Each metric has 4 benchmarks. I know it's really hard to see there, but hopefully you have copies of the PowerPoint in front of you. There is a target, which is the highest performance expectation. There's a midpoint, which is halfway between the floor and what we have as a target. There's the floor, which is the minimal acceptable performance, and then there's critical, at the point to consider significantly below the floor. It is important to note that the scorecard is a year-round ongoing process for DHS and CUA. The scorecard has become embedded into the culture of the agencies. Based on scoring, we have developed an accountability system that's tied to the number of bells received by the CUA that adjusts the way the DHS targets and prioritizes our training and assistance to the CUAs. In addition to specific trainings by the domain, this may also include plans of improvement and organizational assessment and peer mentoring. On a quarterly basis, DHS reviews 15% of all of each CUA's cases. Then we provide reports on system and CUA level data, as well as quarterly score updates that enable the CUA and DHS to remain laser focused on improving outcomes for children and youth. We are tracking progress over time to make sure that no CUA falls into the critical or failing category, but we are prepared if a CUA is in a critical category or does not improve over time, we would then transition that work via an RFP. Given the first quarter of the fiscal year 18, we are optimistic in the CUA's progress from the baseline data. And I want to call to attention, I hope you have these on your desk, that shows the progress that we've made over time. I think it's important to note that the initial scorecard was really a baseline, and what we hope to do is measure progress over time. Bolstering this prognosis is the CUA's case managers now have an average caseload of 11 cases and have nearly reached our goal of 10 cases, but we know there's more work to be done. In addition, the CUA case managers' retention rate has improved, and there is less turnover. We have currently within the first quarter a 96% retention rate of the CUA case managers. We believe that this stability and the laser focus on the challenges will further improve the CUA's ability to provide quality services to our families. Part of our journey towards improving outcomes for children is strengthening the partnerships with the CUAs. I know we'll hear from Don Holden, who will provide more information to see it from the CUA's perspective and how the scorecard has been incorporated to their quality assurance efforts. Thank you for inviting me, and I am open to answer any questions now or later.
Thank you very much.
Thank you.
And so I have a number of questions. I first want to acknowledge the presence of Councilwoman Blondell Reynolds Brown, who I just saw, and also Councilwoman Maria Quinones Sanchez. Oh, and Councilman Curtis Jones, Jr. So my first question for you, and I know that there are a lot of questions among the members, so I'll be brief and then I'll come back around to some additional questions. But the first, I think, and the biggest question I have for you is that the report that was issued, in my opinion, really gave us, to me, it presented a lack of confidence in the CUA system. And so from your, I don't know what page it is, it's not number, but the next to the last page where you go through the CUA scorecards and the benchmarks for performance, and you listed where the target should be, the midpoint, the floor, and critical. And so when I look at this report, everyone, almost everyone, is critical in the report that you issue to us.
I think they were a level up and not at critical.
I'm sorry?
In terms of that, the red is critical, so you see that they're above critical.
I'm sorry, I can't see that. I can't see
It's also in the PowerPoint. I don't know if you have it in front of you.
Okay.
So the critical is the red line that indicates that if they were below the floor, which is the minimal effort, so nobody's failing. I won't even be, I want to say I can completely understand why this scorecard as it represented would certainly call into question confidence, but I am pleased to say that nobody is at the critical or failing mark.
I would disagree. And so, because, again, we're dealing with children who are in a very delicate situations, who really need the time and attention of our CUAs, of DHS right now. And so if I look at, just as an example, if I look at, let's say, for example, CUA number 2, from the report that you gave us, from the scorecard. In permanency, they received a D. In safety and assessment, they received a C. And I'm translating from the Liberty Bell system, which I still don't understand why we use this Liberty Bell system versus the traditional grading system, which the report itself lists on the back page as the letter grade equivalent.
If I can also just address that
Sure.
for a second, having a father who was a school teacher and recognizing that some of our members of council have worked in the education field, grades fall within a 10-point bracket, and these have different weights. So not every domain has the exact same. So we went with a 5 rating system, which is pretty common in terms of having, whether it's stars, apples, tomatoes, bells. We went with Bell because the pride of the city, and as the department, we're really proud of our work, and that was the intention, not to be disingenuous in terms of grades versus bells.
Okay, I hear what you're saying, but at the same time, I think that providing a letter grade equivalent provides the clarity and the transparency that you talked about in the beginning of your comments. That sort of information is easy to translate and is plain spoken and really allows us to understand exactly where these agencies are. And so, but based on what you gave to us, CUA number 2 had a permanency grade of D, a safety and assessment plan of C, safety and visitation was a D, case planning was a D, practice court was a D, court was a D, supervision was a D, assessment, health and education was a D, finance was a C, and workforce was an F. And so I can't understand how these are grades that aren't, or an evaluation that's not considered critical.
Well, according to how we measure this, I think what we've talked about is we didn't grade anybody on a curve. We wanted to be very honest about things where we clearly needed an improvement, and so we measure these on a quarterly basis. And I'm pleased to say that there's progress, but certainly I can understand how that there would be that perception or concern given the ratings that you
So when is this
So the overall,
information from?
so this is demonstrating the measurement of their percentage in terms of how we weighted, where they fell in terms of critical. So remember, critical would have been 1 bell. None of our KUAs, their overall score was in a 1 bell category. We certainly had a number of them who were in a 2 bell category. So the overall score for KUA 2 was 2 bells.
Well, actually, I'm looking at KUA number 8.
Okay.
Which, according to my calculations, had 1.67 bells.
Well, but I'm sorry to, and we could definitely get into the methodology, but I was just saying we could break down and I could provide the level of detail in terms of how some areas are weighted heavily and others. So for example, safety is of greater importance to us. So you can't just take a 10 number average of these bells to roll up the average that you came up with.
It has to make sense. This doesn't make sense. I can't look at a grade or a rating system. So a rating system number or KUA number 8, the grades translated via Liberty Bells are in those same categories I mentioned before. D, 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 F, F, D, F. And so that can't be considered, anything but critical, in my opinion. And I don't understand, and I'm not a social worker and I'm not an educator by practice, but this does not make sense that would be acceptable in any way, shape, or form. And if this is a level of acceptability, then I would say that the whole system needs to be reviewed and looked at in terms of how we are operating and what we are providing to children who are in distress and families that are in distress. This is, this is not acceptable.
Can I have a point of information,
Sure.
please? Can I get some clarity on the document you are speaking from and what's in front of us?
Are you referring to this?
The
Yes.
document that Chair Lady
The
is speaking
scorecard.
from? And that's in the materials that we have here?
It should be. It was part of the report that was sent out to City Council in the fall.
So we don't have that right now in front of us?
We'll get it.
We can get you a copy of it, Councilwoman.
Okay. And so with what the Chair Lady is referencing from, the document that the Chair Lady is referencing from covers what period?
That was fiscal year 20, so it ended in 2016.
2016.
It says here July
July
2016 to
through-
June 2017.
So the most recent fiscal year.
Forgive me?
So the previous fiscal year, not the fiscal year that we're in now. So the fiscal year that ended June 30th, 2017.
Okay. And so with that answer, so the bells on this sheet that we do have in front of us equal what the report that the
So
Chair
that's
Lady
a roll-up of the progress, because the report
Okay.
card, is that what we committed to is that this will be an annual document.
Okay.
And so this is a high-level view of the progress that's been made since the baseline.
Since the baseline.
So we're very pleased to report that every KUA has seen significant progress, some more than others. And we now have 3 KUAs that have 4 bells. We have now 3 instead of 4 at 2 bells. But even within that standing, there has been significant progress.
So where I'm further trying to get clarity is, given the concerns raised by the Chair Lady from that report and what we're looking at now, we're really not all reading from the same sheet of music, is what I'm hearing. Am I correct?
Well, correct. This is dated information. And the
Okay.
goal of this information was to create a pathway for improvement. And so what we can say about the first quarter is that we've seen improvement from the concerns that I think have been appropriately represented by Councilwoman Bass.
Okay. That answers my question then. Thank you, Council Lady.
Thank you. So back to Beth Anna, KUA number 8. So can you talk to us about how that scoring is considered to be acceptable by DHS?
Well, so the dated, the dated and the information that was represented in the fall clearly indicated that there was significant improvements needed for Beth Anna. So we've been working very closely with them. We're pleased to see that they have made progress. But certainly, we are concerned for anybody who was at the 2-bell rating.
1 and 2. 1 and 2 bell rating, yeah. Okay, Councilman Greenlee and then Councilwoman Rondo Reynolds-Brown.
I'm after Councilman Green.
Councilman Green.
Yeah, thank you.
Sanchez.
All right. Thank you, Madam Chair, and thank you for all the work you're doing in leadership on this issue. I think we all have questions on different things, but I wanted to focus on just a couple had issues. Good morning, Commissioner.
Good morning.
On the adoption issues, I think we're going to hear at least from one witness that had particular problems, and I've heard from others about just how long the process takes. And one of the issues seemed to be what appears to be lack of coordination between the courts, the social workers. You know, it just that, you know, people show up for hearings and the co-worker isn't there, and then the next time the judge continues the thing. And I know we can only control the court so much, they're their own entity, but there is, it just seems that it's it takes a long time. So I guess my question is, does your office work with the courts at all to try to deal with this issue, you know, and...
Yeah, so I'm going to start from the top in terms of just the length of time and sort of the realities that are being faced when we're managing sort of that really significant end product of adoption. Our work requires that we're consistently concurrent planning. And I think one of the hardest, most challenging things for our department to do is to take that really significant steps that terminates parental rights.
Can you talk just a little bit more in the
Sure.
mic? I guess I'm getting old.
I'm sorry, can you hear me?
Yeah, that's
Sorry.
better. Thank you.
Usually you can hear me really well, so. I was just highlighting that the very critical decision to terminate parental rights, meaning that you know, the parents who gave birth and are the biological parents will no longer have any legal rights to that child can be a very long process. Depending on the work and the involvement of the family in that process could impact that. There's also a number of human factors, as you mentioned, whether it's a particular party is not available at the court hearing. That is certainly something that comes up, but we know the length of the process of the time that happens both at a national level and ours, and we can certainly improve. We have actually recently started working with Casey Family Programs around what's called a rapid permanency review. So if a child has been in our care for over a certain period of time, we do a specialized review of that case in order to move it along. But yes, I can't underestimate the concurrent planning where we're trying to work towards reunification or adoption, and that becomes a very difficult place for a social worker, a CUA worker to live in as you're trying to determine the ultimate permanent goal for that child.
Yeah, I understand. I guess when I talked about the coordination, I was just wondering what interaction maybe you said this, I'm not sure, interaction with the courts to try to lead. I mean, it's going to be a difficult situation anyway,
Yep.
but to have people, and again, you'll hear from one witness, it sits
Sure.
for 4 or 5 hours, and then it gets continued, that kind of thing. And courts do that, I get it, but I'm just wondering if there was any like ongoing conversation with the courts on that, I guess is the
Well, we meet
question.
administratively with the courts.
Yeah.
Because we're party, it would be inappropriate for us to discuss a case offline.
No, I know, individual.
Right.
I'm
So, but
talking
yes,
general,
we work on a regular basis, and the courts have done, because of our increase in services, they've done a tremendous job of actually adding additional courtrooms to support that work. But certainly the length of time and the backlog is certainly something that we continue to work with the courts with. So there is a lot of coordination with the courts.
I was just wondering your comment on this. I think we're going to hear from the Defender Association, and one of the, on the issue of adoption, one of the issues that they raise is they think that, at least on the adoption issue, that maybe it should be turned back to DHS instead of the CUAs. Do you have any comment on that?
My reaction would be is that it would further delay the course of any evidence. All research shows that when you transfer a case to a different social worker, you lose 6 months. So I would recommend highly against that. I think that there's ways that we can improve the challenges, and very open to hearing other ideas that the defenders and other advocates might have to improve that system. We've recognized it's an area for us to pay very close attention to.
Okay, I guess to reverse the question then, Have you seen significant improvement once it was taken from DHS and given to CUAs? That
Our
there has
permanency
been
rates
on the
have-
adoption issues?
Yes, and actually that was one of the data points that I
Okay.
referred, and if we can go to that slide, we have actually seen an increase in permanency rates since our move to improving outcomes for children.
Okay.
I believe it went from, if you indulge me in a second, it went, I can't read that small, that far away. 1 second, I'm sorry. So we went from 1,322 kids in fiscal year 2013 to 2,024 kids in fiscal year 17. So the needle's certainly moving in the right direction. So we went from 1,322 kids, that was before improving outcomes for children in the CUAs, to 2,024 kids in 2017.
Okay. I know everybody has questions, so I just ask one more. You said about reviewing 15% of each CUA's cases on a quarterly basis. How are those, is that just random when you pick what to review?
I'm just going to ask Lisa Rodriguez,
Sure.
who heads the Performance Management Technology Division for DHS.
Thank you. Good morning.
No,
Okay.
trying to.
Okay, sorry.
There we go. Now we can.
Again, it's a privilege and an honor to be here. My name is Lisa Rodriguez, Deputy Commissioner for Performance Management and Technology. So we do a random sample of our cases, 15%, it's about basically, depending on the census of the CUAs, it's about 600 to 700 cases per quarter. To give you a sense of the volume that we're evaluating, when the state inspects us, they review 50 cases. So we're reviewing a significant proportion of the cases, and it is a random sample, and we have an algorithm that we use to make sure that it's random, while including in-home cases and also placement cases.
Okay. All right. Thank you. I have other, but give everybody a chance. I'll
Okay.
move on. Thank you, Madam Chair.
Thank you, Councilman. Councilman Green?
Thank you, Madam Chair. Thank you, Commissioner, for your testimony. I want to follow up on a phrase that my colleague, Councilman Greenlee, used, which is coordination. And I want to couple that word with the phrase communication. And I say that based on my experience working for Councilwoman Tasker when she chaired Public Health and Human Services, and at the very beginning of the IOC and the CUA concept here in the city of Philadelphia. From my observation experience, this was a very top-down approach from the administration in coming up with this initiative, coming out of the Blue Ribbon Commission and the unfortunate situation with Danielle Kelly. And then going forward, as the implementation went forward with IOC and CUAs, there was clearly a lack of collaboration, coordination, and communication, and it caused a lot of challenges from my observation, both from those on the CUA side and also on the DHS staff side and members of District Council 47. And so the scorecard to me is a snapshot, just like when you are doing a balance sheet, it's a snapshot in time of where you are. I know for a period of time we were looking at doing hearings on this issue, and I'm glad Councilman Bass has moved forward on this initiative. And so over the past few years, I've heard a lot of issues and concerns from hotline calls and those type of things, but we're now in a new administration. And so we've had this scorecard, this snapshot. And so my question is in reference to going forward. What type of collaboration will be occurring to continue the assessment of CUAs? How will that collaboration engage and include members of District Council 47, CUAs, community, parents, and stakeholders in reference to how we move forward regarding both the assessment of CUAs as well as coming up with improving outcomes for children and also in the system?
Thank you, Councilman Green. A few things I just want to highlight, and I certainly welcome, certainly when Dawn represents from the CUA perspective, but I think the collaboration and the partnership is a critical one, and so the CUAs are one of many parts of that partnership. One of the things that I'm very pleased to report is that that partnership has definitely been solidified and that we're operating much more as one system. And that partnership, certainly at times it felt challenged at the start of improving outcomes for children. And so I'm pleased that it really is moving to a place where it is much more a concrete partnership. We meet on a regular basis at all levels, and one of the things that happened with the change of this administration is that integration is not just occurring at a leadership level, so the CEOs and the executive level staff of DHS meet on a monthly basis, but every level of management meets in an integrated fashion between DHS and the community umbrella agencies. That did not happen at the point of implementation, but that's something that's now been in place for over a year. The other thing, which is also highlighted in the PowerPoint, I believe it's slide 17, that just talks a little bit about how we manage the process and the progress of our involvement. So there are a number of pieces that happen not just on a quarterly basis, but we're meeting regularly with the CUAs on performance. There's also a number of reports and data that they get on a regular basis. One of the things that we have talked with council about is it is very much a data-driven tool, and how do we better utilize family voice, kids' voice in measurement. So we're still working on that family engagement piece, because how do you measure that in a way that is meaningful and fair across the board? But I was just going to have Lisa walk through and Heather, if you can go to that timeline that just lays out, because there is individual review, there's group reviews, there's individual meetings, so I just want you to have a sense of the significant engagement that happens with the CUAs regarding their progress.
Yes. So we, as you know, as we said, we released the baseline report in the fall. We meet with, at the quarter mark, we scored the CUAs on our quarter, we met with them, and in your one of the things that I did want to talk a little bit about was the accountability structure. So at that quarterly meeting, we discuss if you're overall at a 4 or a 5 bail level, we still meet with you. We still want to understand what areas you're working to improve, and then what are the best practices that we can share across the system. But you don't necessarily have to put together a plan of improvement because you have 4 or 5 bails. If you have 3 bails or less, there's a very rigorous process of putting together a plan of improvement, working with DHS University, and depending on the bail level, there is a lot of leadership involvement in working with the CUAs. And of course, if anyone is at critical, we always would have the option of reviewing whether that's a CUA that would continue to be viable. But if you look at the annual schedule, so we have the quarterly meeting. At the 6-month mark, we look at progress, at 6-month progress. And then we do an individual quarterly meeting with the CUAs again at the end of the fiscal year. So that then we are all on the same sort of understanding of the scores, areas of improvement, and actually areas of best practice, because we do have some areas of best practice among CUAs. And then the first annual CUA report that would scorecard that measures progress against the baseline on an annual basis will be released in the fall again. So there's an intense level of engagement with the CUAs, both from the case managers up to the leadership, but it's structured and built into our annual accountability calendar.
So I wanted to follow up on your point, and I acknowledge the fact that you are having kind of more vertical communication at all levels between management and with staff and the CUAs. And you also gave us some information regarding the scorecard process. But in those communications at those various levels, are you receiving input from CUAs, DHS workers, community stakeholders, other individuals in reference to how the scorecard should be used? What input are you receiving from them in reference to helping to compose that scorecard? Because having the communications is one thing, but if you're not actually using the information as a way to improve the diagnostic tool on how to assess the CUAs, that's a different thing. And that would show to me true partnership, not only having a conversation, but actually taking action based on the information receiving.
So a two-part answer. One is I think it's an excellent idea for us to think of stakeholders outside of the CUAs in terms of how the scorecard can continue to evolve and enhance to paint a better picture. We do meet, and when we were issuing and rolling it out, we got a lot of, so the KUAs were involved in the development. So we didn't develop this completely devoid of the KUAs. I would say that we were all a little bit anxious because I will be honest, the results reflected where we thought we were at a point in time. And so certainly getting everybody prepared for what did that mean and what was the response publicly that we were going to have of taking sort of the courageous step to say, this is where we are and this is the improvements that we need to make. So I just want to assure you that they were actively involved and not shrinking violets in the areas where they think we had to push back, and so we did make some changes as a result. But we also made it clear, and I'm sure they would tell you, that we're the oversight body, so that there are some things we had to push to make sure that we were going to be responsible for as a system. But involving, we've certainly talked with the courts and other key stakeholders when we've presented this, but I think getting more feedback around how do we enhance it is an excellent idea, and we will definitely follow up with that.
And I think that involvement should be more than just a community oversight board. I mean, having these outside stakeholders goes back to my point of collaboration, communication, because they can provide information, feedback from their perspective on what's working, what's not working, and help to provide a better tool that will give people more comfort on, is this a real assessment of how KUAs are doing and how they're really trying to improve the outcome of children in our city.
I agree. Thank you.
Thank you, Councilman. Councilwoman Brown?
Thank you. Good morning. Good morning.
Morning.
I'd like to first, continuing along the line of coordination, speak to and give us an update on the progress that has been made with the School District of Philadelphia, and then share with us where there's still hurdles and impediments.
So given the nature of the number of children that we're engaged with, that obviously are children who are engaged in this Philadelphia School District, we have a very high level of engagement with the School District of Philadelphia. And so a number of years ago, we developed what's called the Education Support Center. And so the Education Support Center is a unit within the Department of Human Services that works with children who are what we call system involved, meaning that they're known to DHS. That staff is physically located at the school district, as well as a number of the social workers who are part of the Education Support Center are physically located in a number of schools where there's a high concentration of DHS involvement. We also support their work in a number of areas. Not everybody knows that DHS funds the majority of after-school activities that happen both out of school district buildings and rec centers. So that is a tremendous amount of coordination that happens at an operational level. I meet
On the front line, so to speak?
Exactly. So I meet on a regular basis with the senior leadership of the school district. On an operational level, we work almost daily together, whether it's a rerouting of a bus route for a child who's been placed, whether it's ensuring that their documentation, et cetera. Certainly, our opinion has been that we need to be as close and as good as partners to the school district so that we can support them, just given the nature of the bandwidth that they have in order to respond to the needs of the kids that are in the system.
That's deeply encouraging. 10 years ago, the relationship, the communication between those two huge organizations was almost void. And it was a fair criticism, I thought, as a newbie on this body. So I'm pleased to see that there have been some intentional strategies put in place to ensure that we wrap our arms around these kids who need that kind of coordination. On the issue of truancy, so what are the triggers that a school district officer, counselor, teacher might see, truancy being one, and how is that then communicated to DHS? Because truancy, if not arrested, for sure leads to other things.
So, Councilwoman, I have this awesome presentation on truancy, and I don't have it with me, but I do want to highlight that the issues related to behaviors and activities that underscore truancy do vary by developmental stages. So some of the issues that relate to children not attending school in the lower grades are generally more family-oriented or coordination, whether it's a child care issue, a transportation issue, et cetera, versus older kids where they're self-selecting maybe to not attend school. The rate of the attendance issues is a real challenge, and so on a positive note is the level of discussion and coordination that's happening with the school district is pretty extraordinary. So we provide prevention supports to the district once they identify and recognize that there's a child who has hit their threshold of what qualifies them as truancy. In the Commonwealth of Pennsylvania, truancy can lead to a child welfare dependency matter, so that's why the child welfare system gets involved. We've been working with the district quite a bit because we want to make sure that we're reducing the number of kids who might end up formally involved in our system solely because of truancy. Right. All the research shows that placement or removal from a home based on truancy does nothing to encourage a child to continue on their educational path.
So what's the magic number these days with regards to how many truancies a young person can have before it hits up against your system?
Oh, so the magic number...
Because that's been debatable over the years.
10. I'm looking for so it's 10 unexcused days. There's benchmarks, there's legislation as it relates to the school district. So once they get to 3 days, they have to enact a certain process, 7 days, and then 10 days.
Okay. And my final question, at least for this round, is given the reason that brought us here, concerns raised by the chairwoman, and given the report card, the former report card and the current metrics now, where is there, what type of technical assistance do you provide to those CUAs who are failing?
Sure. So the Deputy Commissioner who referenced these quarterly meetings, we have our training and technical assistance arm attend those meetings. So the great thing about recognizing where they're having challenges, so if it's supervision, we then provide very specific supports from a technical assistance standpoint in terms of whether that's on-site, retraining, or a refocus for them in terms of supports that we give them. So it's not just like, oh, this is where you're not doing well and then good luck. We're working with them on that specific measure. Did I answer your question?
So DHS University, which is our technical assistance unit, we have them co-located at the CUAs.
You have them do what?
Co-located. We have
co-located.
They are
okay.
like we have DHS staff that provide technical assistance at the CUAs. And what the scorecard has helped us all do together is really align the technical assistance provisions and the trainings and the one-on-ones, because there's a lot of one-on-one coaching that happens too from DHSU with the CUAs, is the scorecard is really identifying the areas that technical assistance needs to focus, which, prior to having the scorecard yet, there was a lot of technical assistance taking place on a lot of different issues, and this has allowed us to really say these are the things we're going to prioritize.
So this is in some ways, on a lighter note, a rhetorical question. Who is the mayor that initiated and founded the notion of a scorecard? Mayor John Street.
So,
right.
Oh, yeah.
He gets the credit for that.
Okay. Because we had there was the children's
report card?
Yeah, like with all the services, right? Yeah.
So that just needs to be stated for the record.
Yes.
Okay.
Thank you, Councilwoman.
Give credit where it's due.
Yes.
Thank you very much. Thank you, Madam Chairwoman.
Thank you, Councilwoman. Councilwoman Sanchez?
Thank you, Madam Chair. Thank you, ladies, for coming up here today. Couple of things that I want to ask regarding this. I know how difficult this scorecard is, and I do want to give you credit for owning the level of improvement needed. I think, that's bold in saying we have a lot of improving to do, right? And so for those of us who these were piloted in my district and I lived the living pains with my providers, it was not easy, and we found a lot of difficulty, and I do appreciate that the administration has been more willing to work with the providers around how do we help children and families, right? A lot of the problems that we see here are the adult problems, and we really got to get our hands around how the adults and the resources get to the kids. With that, what is the thought process when there was a decision to close Wordsworth? Why wasn't there a consideration, and you know I've been on the record, these boundaries are not community boundaries. And our unwillingness to use that opportunity of closing one center to look at how do we make these more consistent with communities of interest, all of the other things that we feel are important to keeping kids within families and those boundaries. Why was the decision not made to allow some of the other providers to assume some of these and keep these boundaries that all of us have a problem with?
Great question, Councilwoman Sanchez. So a few points to reference is last fall, I believe it was November of 2016, the state who licensed the residential treatment facility for Wordsworth closed that down. So that facility which operated was closed. The CUA, we looked immediately, which had a different management structure but recognized still same agency, still under one CEO. We looked at the work and recognized that it wasn't residential work, but we also, as I shared with all of council during budget testimony, is one of the lessons learned of implementing this transition, this transformation, was the quick shift of case management. And we did that too quickly, and that created tremendous problems for the system. So we knew that it was going to be challenging for us to quickly transfer. It was during that time that Wordsworth, as an agency, put out a bid to look at an acquisition process. They had 3 respondents, and that process began to proceed. And then we were pleased that from our standpoint that the highest performing CUA is that who acquired the contracts from Wordsworth's CUAs. So we now have Turning Points operates 4 of the CUAs for Department of Human Services, and our contract is with Turning Points for Children.
I understand that, but we're never going to get to a place where we're going to make these CUAs more reflective of the community feel we want if we're not willing to address it at some point, right? And I just feel like that keeps getting thrown. And I say this because, again, you know, part of this goal is recognizing mistakes made, you know, and I feel like, and you know I feel very strongly about the fact that I feel that DHS needs to retain capacity to take care of all of this because it is our responsibility and our obligation. And this is one of those opportunities where we could have looked at our internal capacity and kind of the external.
Can I just comment on one point related to that? And I you know, because we've had a long history of talking about this, that 2 points. We believe very much in that the work has to be reflective of the constituents we serve. And so I just want to highlight, which was in the packet, I don't have in the PowerPoint, is we've made a really significant commitment to encouraging the CUAs to have diverse representation. So 50% of the CUA leadership is now minority. That was not the case when we started. And over almost 60% of their boards are also minority. So there's been an increase in our reflection of how we're reflective. But I also, there's a lot to unpack, and I know it's more than that. In terms of retaining capacity, I'm going to ask your help because one of the issues that the state continues to challenge us on is that they don't want a dual system. And I would argue we do not have a dual system. DHS has retained a very, very small unit that still has a small number of cases. And there have been from time to time where we've had to return a particular case back to DHS. So there is a small capacity, but we don't have in standby an entire child welfare system ready to go. What I can assure you is that we have a much more formalized plan for in the event that we do need to transition a CUA. I will tell you, I was very early in my tenure at the point of the tragedy, and we were not in a position because we were still stabilizing to make a transition like that.
Well, again, I think that and again, the messaging in Harrisburg gets lost. I don't know what happens on that turnpike, right? But the message gets lost the other time, which is why we make a lot of tough decisions over here. I think again, how we articulate one system to me is one system, right? Whether it is being taken care of with internal staff that, and I know that you've worked at trying to get a better synergy between the internal staff that was demoralized and had a whole lot of knowledge, and the core relationship, and that's not an easy situation to navigate. I just feel like the reason this looks so parceled out is because it is parceled out. From geography to who's the provider. I just feel like I think we're at a better place, but I still think there's no rhyme or reason for some of this, right? And I know that one of the reasons we kind of privatized and went into this model was because we were giving it to providers that had this whole host of support systems that we felt were going to be better at serving kids. Unfortunately, we still hear stories about some of the disconnect as we'll hear testimony later. I want to go to the management side of this because again, this is adults making adult decisions for kids about what's more convenient for the adults. On the administrative and the management side, one of the challenges we had in the beginning was flexibility, in terms of how KUAs manage their money. We've heard over and over KUAs saying they need more money. Where are we in this discussion about, again, and for me, the resources getting to the children and the families? Where are we with managing our budget? Some money got turned back, people weren't allowed to hire, there's that 6-month training thing that you got going on before people can get a case management, all that stuff. Where are we with all that?
I'm so impressed by the level of detail that you know about our system. I'm very, very happy to answer these questions because I love that you're in the weeds. So a few things. One is that, yes, that was clearly an area, Councilman Green had talked about the collaboration, and some of that was the frustration that had to do with fiscal limitations. So at a high level, this administration made some significant key investments. One is that it committed to funding case ratios at a 1 to 10 so that we increase the financial resources that KUAs could hire more case managers. I would encourage you to ask the KUAs that come up here. I'm sure they would always welcome additional flexibility, but in working with the new finance staff that we have at DHS, we tried to create as much of a partnership around building of budgets, also recognizing some areas of the city that have greater needs than others. So that those are just, and in addition to that, at the work level, this administration made commitment to increasing the amount of money that we pay foster care parents. And so that's the first time in a decade that amount was increased. So financially, we definitely increased the amount of money that we were supporting to the KUAs, and also have tried to figure out what are the areas that we provide flexibility for them in regards to their budgets. A lot of that is in personnel. Another, we can argue whether or not they felt that this was a burden, but one of the things loud and clear that we heard was the contracting of the subcontractors that was under the KUAs has now been transitioned back to DHS. So the foster care providers get paid directly by DHS. And so that's been a welcome change, and we also do the monitoring. So our goal was let the KUAs do the work that we've asked them to do in the community and not become, administratively and financially bogged down. So those, I think, were positive financial changes that we made, and I would just encourage you to ask Dawn.
So one of the frustrations that our chair lady has, rightfully so, is when you look at this report card, it's really hard to get to apples about what is this system doing in comparison to the system we had.
Yeah.
So I just want to say an excellent point, and I could get in trouble for saying this. We didn't have a system to measure ourselves at this level of detail before.
Right.
And if we had put DHS through the scorecard, I do not even want to begin to think where we may have landed. We could make speculation. Some people would say we're at 5 bells. Some would say we're at 1, depending on who you're talking to. I will just say we did not have a rigorous manner in which to say how DHS was performing at the level of which we do for the KUAs.
But we did have blue ribbon commissions and others that kind of highlighted where we knew some of our issues. So I guess to that point is, then how do you measure this financially, right? In terms of we're serving more kids. And again, my thing is, how are we getting more resources to kids and families in this system versus the previous system? That we can measure. right?
Yeah.
Because I think part of the challenge that you see in some of the questions around flexibility go around where the children are and what they need. You know, and I know you've addressed the issues around transportation. I have a huge issue with 4 or 5 providers in a household and the roof is leaking, right? And we hear those stories all the time. It's like we're spending $100,000 in the family, but they can't pay the rent and the roof is leaking. And so we could do a comparison around financials, and I think it's important that we look at that. You know, yes, we need a better system, we need a more efficient system, because the goal is to get the resources to the children and the families. And is this system delivering on that in comparison to our previous system?
Yeah, I mean, I think the data, not discounting the financial, the data shows that we're in a better place for the outcomes related to the families we're serving. The one place where we as an entire child welfare system have significant improvement is the number of kids who are in our care. So in the wake of the Jerry Sandusky laws, we increased double digits for, you know, in terms of our hotline calls, which resulted in the number of investigations. So we rose, you know, pretty steadily. I think, well, so the success is that for the last 18 months, we have stabilized that number. So we were increasing, and it was on a very high trajectory. And for the last 18 months, we've been at 6,000 kids, give or take, you know, between that number. And so until we can get that number further down, that's where some flexibility can come. But what we don't want to have happen, and this could be something that you guys could be very helpful to me and the department, is if we start improving by reducing the number, we don't want the state to then hurt us because we're doing such a good job of reducing the number and then they reduce our budget. And the stabilization that we've been able to do is because the state has equally invested in some new areas. And so I think that has been of support to us.
Well, they're very good at legislating and mandating unfunded mandates.
The last thing I'll add is that the reduction in congregate care has been really beneficial for the budget because it's a much higher cost. And so having kids physically in their homes or with kin is you know, it helps the budget as well, but we don't want to get penalized for further reduction, which is our goal.
Okay. So, and the last question is, and I don't want to manipulate, I know Councilwoman Kim has some questions, is, again, one of the selling points to this was better wraparound services. Tell me how you're realigning prevention dollars to making sure that our kids in our care are getting access to those funded services, and with CBH and the trauma services being offered, and what, if anything, has improved with the CUAs who may be in those dual systems, and how we're monitoring that too, right?
So there's a few different things.
I'm going to start. You're now on the board of CBH.
No, I know. I am. So I'll start backwards. In terms of CBH, we are doing a number of areas where we do joint monitoring. We keep each other abreast of any concerns related to providers.
Can I get joint accountability? Monitoring is just too vague for me.
I will pass that along, Councilwoman.
So, it's too vague. What is
I mean, we keep each other abreast, so each one of our systems, depending on the particular need, right, has to hold their provider accountable.
So how does a CUA case manager who has a child that's in a bad treatment trauma services influence that right now? What is the protocol?
We've had those issues come up, and we certainly asked them to bring it.
So it's too vague. What is the protocol?
The protocol is it's brought to Deputy Commissioner Ali or Mai's attention, and we have actually CBH staff embedded at the CUAs, but if Kim, you can maybe...
Please don't give me the embedded, we're sitting next to each other thing, please.
You don't want that answer?
No, that's not enough.
So in terms of the front line, I know you said you don't...
First of all, let me say my name. For the record.
I'm sorry, so my name is Kimberly Ali, ALI, and I'm Deputy Commissioner for Child Welfare Operations. Good morning. I know you started off indicating that you did not want to hear that, but I want to say that I believe that that's where the best work occurs. When you have frontline social workers and supervisors having those relationships with the CBH care
I'm not
managers.
against the relationship. I want to know what the protocol is.
So the protocol is that if a young person is not receiving the treatment that they are entitled to, then the parents have the opportunity to do an appeal, but also the COA case manager has an opportunity to do an appeal. And that appeal, how that process works is that they will send a notice to the CBA's care manager as well as their chain of command, copy myself, we get the doctors at CBH involved and our psychologists, and we work out the level of services that are needed for the young
Walk me through
person.
that. How long is that?
So usually we get a
And is that
response.
spelled out?
Yes, so it's spelled, yes, it definitely is spelled out. And it typically takes, we can get them on the phone, so it typically takes either a day, no later than like maybe 3 days or
That's
so.
not what the folks are going to testify to, guys.
I understand. So what I would say is, for example, I had that particular case just last week in which a young person was in need of one-to-one services. The young person was in a residential facility, needed one-to-one supports. CBH indicated that they wanted to discontinue those one-to-one supports. The provider agency notified myself as well as the COA chain of command. I immediately sent the email to the CBH psychiatrist, asked them to reconsider that decision based on the fact that the young person still was in need of these types of services, the one-on-one services, and then I got the decision back within 3 days in which CBH will continue to provide those services. I think what you will find is that we definitely need to do a better job in making sure that parents are empowered enough, and when they are not empowered enough to make that decision in terms of appealing, that the COA case managers as well as my office walk alongside of the families to make sure that those services occur.
So, do the parents have that spelled out in writing in multiple languages about their rights to appeal?
So CBH actually provides a letter. I can't speak to the multiple languages.
Does
They provide.
DHS provide a letter to their parents to say, if you're not satisfied, it's part of your care, this is what the protocol is?
So DHS has that in reference to child welfare services, but do not have that in reference to behavioral health services because it is a CBH service. However, what we do is walk alongside of those parents. So yes, CBH does have that in writing for parents.
Okay, so that's where the
the
relationship
coordination.
versus the
Absolutely.
accountability is? I think we need to be talking the same language.
Yeah.
A parent's interface with DHS should not be different than an interface with a provider or with CBH. And that's, look, we navigate this all the time. We have to call you folks, and, you know, kudos to those parents who are bold enough to call us. They're council people, right? Most of folks don't, right? And so to the extent that, again, one of the selling points to this system was that we were going to get a better coordination of that, and I still think that we are tremendously lacking in that ability of folks to know what their rights are. Kids' treatment plan is so hugely important and impactful as much as their placement, right? It's their placement and that.
You're 100% correct, and we absolutely have to do better. I will say one piece that I believe can move us in that path is that we talked a lot about stabilization, but what does that mean? The fact that we've been able to reduce the caseloads, and we know we really need to get to that magic number of 10, if we can get there, the quality of these levels of intervention, I would say that it felt very hectic when caseworkers were, had significant caseloads, the ability to do the quality of the level of work. And so I think I take on.
Because we're even at the school district. I haven't even, because I'm going to let Councilwoman Gim do all that, right? She's going to go into that school coordination.
But I'm just saying,
piece of it.
we take this as a challenge, and that we've been working in close partnership with CBH, and with the CUA leadership here, we will definitely need to do better.
I'm going to not manipulate. I got more questions, but go ahead, Councilwoman Chair.
We'll be back to you. We're going to, Councilwoman Gim is going to yield some of her time to Councilman Jones. But before you begin your questions, Councilman, I just had a quick question. Can you tell me who else nationally is using this particular model? Because I know in your comments you said that
So
other child welfare jurisdictions are looking at this model.
So Lisa could give more specifics in terms of jurisdictions. Nobody's using our exact tool that we built with CASE. Other systems are using a scorecard method. We've been reached out to by folks who want to enhance what they're doing or start what they're doing. So a number of us were recently at a national meeting where Missouri is very interested in looking at what we're doing, as well as Arizona and Texas. But I can
but this is only local to Philadelphia.
This is only
not-
local to Philadelphia.
Right, this is, so are there cities within, or is it the entire state of, say, Texas or?
So some of those child
Arizona.
welfare systems are state-run, and some folks
Okay.
are interested at a state level, and some folks are interested at a local level. So while I will just say this little piece is that while I know the information is difficult, and Councilwoman Bass, I completely respect and understand why we're here today, because we need to be. It is unprecedented, the level of accountability and transparency that we have brought to Philadelphia that other child welfare systems are now looking to us to replicate.
But no one else is using a KUA system.
No, there's other, I wouldn't say KUAs exactly, because we came up with that wonderful word acronym. But there are other systems where their case management is not done by the city-county system. So New York, Florida, Oklahoma, there's a number of states, and more states are moving in that direction.
So one other quick question, I'm sorry, and then we'll go to Councilman Jones. So this model, as I understand, was brought to us by the former commissioner, Anne Marie Ambrose. And with a strong recommendation from the Annie Casey Foundation. And so my question is, I guess, really, is it, like, under the leadership guidance or whatever of the foundation, are there other cities that are working with them to develop this kind of system? Because I'm sure there are a lot of other cities that have outside providers. Like, we're not unique in that.
Correct.
But I guess with this particular model is unique to that foundation. And so are they working with other cities? So that we're comparing apples to apples?
Yes, so Casey Family Programs has worked with a number of jurisdictions at a national level who've transitioned case management work. The meeting that I referenced earlier, which is entitled the Urban Child Welfare League, that's cities of significant size that come together on child welfare side. So a number of those cities have worked with Casey Family Programs. I would just say, like, we're unique as a county within the Commonwealth of Pennsylvania. Each child welfare system has some interesting or different dynamics, either how they're licensed, how they're governed. Is it a mayoral? Is it a, where it lives in city government also impacts how some other cities have rolled out this case management model.
So the answer is no? I mean, this is simple.
So there's no cookie cutter that there is KUA in Florida, that there's KUA in Missouri, because we're not Florida and we're not Missouri.
No, I understand, but my question specifically is the foundation working with directly to implement this model, or already has a model like this implemented in another jurisdiction?
Yes.
Where?
So some of the cities that I've indicated, and I can get the list from you for Casey Family, because I don't want to misrepresent a city or a jurisdiction.
Okay, I'd like that information.
Okay.
Thank you so much.
Thank you.
Councilman?
Thank you, Madam Chair, and let me thank you for taking on the tough issues. This is not one of those issues that on its face can be solved in a hearing, and so I appreciate the fact that you are willing to bring this before this committee, and so thank you. I also want to say that, Commissioner, I could not do your job. You see families and children and seniors, not on their best day at graduation and all that good stuff. You probably more than likely see them on one of their worst days, when things are going absolutely wrong. And it is your department and the KUA's jobs to try to hold things together, first in public safety, and then to create outcomes. What was helpful for me, Madam Chairwoman, was this document here that kind of chronicles from 2006, when Daniel Kelly tragedy happened, to 2017, and all of the maturations that have occurred. That was helpful for putting the timeline in context. I wanted nothing to do with your department. To be honest with you, I wanted to cut ribbons on businesses and be a part of the Commerce and Economic Development Committee, where people are having their best day. We came into contact because Councilman O's staffer literally came running down the hallway, and I guess I was the closest fellow colleague, and there was a lady at that time having a crisis because her child had been taken from her, and fast forward, it was a traumatic process that resulted in one of the respite households actually going to jail. I'm not going to get into the detail of it, and so as elected officials tend to do, I go in and I'm going to take my sword and my shield and, kind of see what's going on. And when I got in there, I discovered in a tearful way the stuff you guys have to deal with. So the first thing I'm going to say is that probably you should extend an invitation to our chairwoman and the committee to kind of visit your house and kind of see the different ways. For example, a young person comes into your custody. Like, they can come in from the courts, they can come in from the schools, they can come in from homeless shelters. You actually have a high school for homeless, is that correct? Children?
Foster care. You mean a foster care? Foster care.
Yeah. So you have a high school dedicated to
It's not, but there's one that operates, yes.
And so you can get individual complaints. People can be in crisis. Mom and dad could be going to jail or other places, and you wind up with the kids. So there are a number of different ways they wind up to you. But the one consistent thing for me, Madam Chair, is that when you say to a parent, I, government, can take better care of your kid than you can, that's a very high standard for me, and one that you guys have been dealing with. So I went back and I looked at what I asked, not you, but previous commissioners about what was going on, and it is very difficult to have an apples-to-apples comparison. I know bells versus apples, I don't get all of that, but it is one way to compare. But what I did do was look at some of the questions I asked a previous commissioner. I'm going to ask them to you. And the first one is simply, as a measurement, are more kids graduating from high school now than they were before? That we move the needle in the right direction that way. So a kid that comes into your custody, whichever one of those doors, are more of them finding a positive outcome in high school graduation rates?
Am I answering that? Are you asking me?
I'm asking.
Or you're repeating the question?
That's an actual
From the
question.
Thank you, Councilman Jones. So in all candor, what we do is partner with the school district since, and I'm not sure what my predecessor how answered this question, but since we're not the school district and education is not our primary, safety, permanency, and well-being. So well-being, we have a responsibility to the kids in their care to ensuring that their education remains on track. That is a measure that we're trying to figure out with Dr. Height, how we track that.
All right, so the good news is that the chairwoman and members of council will get another bite at this apple when you come for your budget. So this is an advanced question that I'm going to ask, and I hope you will have positive outcomes answers. Question becomes, second one was, are more kids aging out of the system in a positive way now than before?
So I don't have the, do you have the?
So I don't know the exact number, but we do have a significant, there is a proportion of children that don't age out to permanency, and it is, we need to improve that. And that was one of the recommendations from the external IOC evaluation last fall, was that we need to do an in-depth analysis of those exits to permanency, and we've started that analysis. I don't have the sort of like the year-to-year comparison yet, but that's something we'll be prepared to share at budget testimony.
See, I don't have to know all of what those charts mean. I'm going to boil it down to something that is like a solid measurement, and there's a before, and then there's an after. And those are the kinds of things that I'm going to look for. It was stated in one of my questions before that we kind of take more kids into custody than the city of New York, which is larger, and Chicago. which is larger. Is that still a true statement?
So we still nationally have more kids who are in out-of-home placement than yes. So nationally, we're still at a higher rate, which is part of us trying to address how we look different on the front end, which we've made some gains. I had said earlier, which is in a slide at the beginning, which is that we've stabilized the number of kids coming into care. Heather, if you could go to that particular slide. So, and one of the things I talked about early in the testimony, that slide. So we were in 2013 hovering around 4,300, and then we shot up, and we've hovered around 6,000 for the last 2 years. So that is, from a percentage-wise, higher than some of our national counterparts.
Can you point to one reason? Why is it?
I can point to 24 reasons. They're through the changes in the Child Protective Service law changes that happened in the wake of the Sandusky trial. So the reporting requirements expanded pretty dramatically. And then, so if you go to the slide, Heather, of the hotline calls, so this, the one before, so this represents, and you'll see, I know it's in teeny tiny writing, but if you look at the number of calls that we answered or took as a referral, as an actual referral in fiscal year 2014, and where we are now, by next year, we'll probably doubled the number of hotline calls that come into the Department of Human Services in Philadelphia.
So how are you internally adjusting to that increase?
So my mouth is getting dry. I can totally answer this, but I'm going to ask Kimberly, who oversees the operations part, to talk about some of the innovation that we have put in to slow down.
Yeah. So, good morning.
Good morning.
Good morning. As the commissioner indicated, the number of reports and calls that we received from the hotline increased dramatically in the wake of Jerry Sandusky. So in order to address that issue and ensure that the families that were accepting for investigation were families who really needed to have the heavy-handedness of an investigation from the Department of Human Services. So as a result of that, what we did, number one, was we increased and looked at staffing levels on the hotline to make sure that the hotline was appropriately staffed. So we had to switch some staffing around in terms of some of the hours of operations, because we were also, because of the volume, experiencing a number of drop calls. So we took an analysis, looked at the number of drop calls, and we put staff strategically and intentionally in those particular slots. Additionally, what we did was we staffed it with 2 additional units on the hotline and 2 supervisors and 16 social work service managers from the Department of Human Services that we call field screening units or field screening social workers. So when we have a report that comes into the hotline and that report meets a criteria in which it is a general protective service report, so not our high-end CPS or child abuse reports that consist of sex abuse and physical abuse, those reports we automatically take. But we do have some reports that we call general protective services that might be a supervision issue or some other issue, and those are labeled as our 3 to 7 day response time because they don't have the critical nature. What we do is if we look at those reports and we will deploy a staff person, so a DHS investigator from the hotline out to that particular family home, make an assessment of their family. If the family does not need to be accepted for investigation, we divert it over to prevention. So we dramatically decrease the number of investigations that went to our hotline as a result, our investigations as a result.
2 quick questions, and I want to yield back to my colleague. Reunification, when you take a child from a home, where are your stats on the outcome as opposed to them being permanently placed somewhere else or even adopted, to the fact that there's a happy ending to the story either with the parents or their family members? How is that stat moving?
So we have it, so permanency is broken down into different kinds. So there's reunification, which is the family has been able to reunify. There's adoption, and there's permanent legal custody. And so starting with the good news is we lead with the indicator that's most important, which is reunification. So reunification for any child welfare system should be, and if it's possible, given the family's dynamic, that you lead with that. So we've been able to increase the number of families who go through reunification. In terms of percentage, Over the course of the years, we have remained about stabilized. The area where we can improve, where we have done better, is adoption. And it was brought up earlier that certainly the backlog, the timing, one of the impacts that we believe the transition in the IOC and just transitioning case managers, we believe that slowed down the timeliness of adoptions. And so that's somewhere we have a real laser focus.
So, when Commissioner Ambrose was there, one of her goals was to stop sending Philadelphia children way out to Ohio and the Poconos where they had a false sense of reality. There are neighborhoods in Opeyville where the deer and the antelope are playing when the truth of the matter is they have to have survival skills in Northwest and West and South Philadelphia. To what degree have we moved those placements and outpatient treatments or whatever they are to more Philly-based? Have you made progress with that?
So we've made significant progress in the fact that our overall use of congregate residential care is at an all-time low. So and that's been a huge change as a result of the CUAs and IOC. So we're at 12%. Before we started, we were at 21%. And 12% sounds like a good percent, right? But what does that mean in numbers? 771 kids. That's a huge decrease from previous years. The other thing, and certainly this is something we've worked a lot with our stakeholders, is we have very few number of kids who are out of state. There are some rare instances where we do have kids placed out of state. Some of those instances are also kids who are with kinship care that live out of the state. So that's also an important factor. We look at that number on a regular basis in terms of out of state. My big pledge, and I believe the advocates could share this with you, is it's not enough to me that they're in the state of Pennsylvania. I would like them in Philadelphia County. So we have been working pretty aggressively to reduce the amount of placement of kids on the western side of the state, because let's just say that not everybody appreciates our children in the same that we do in Philadelphia. And so we want to make sure that it's not further traumatizing to children who are in environments where they're not welcome because of what they look like, what religion, or what they appear like in front of others.
Fine, I'm going to, if you decide to take them up and we take a deeper dive over there, Madam Chair, would you be kind enough to include me? One thing I am going to look for you for is a open and transparent parent complaint department or complaint process that we need to, because sometimes you guys come off like very big and, you know, the great and powerful eyes, and just average parents are afraid to come up against you. There needs to be, you know, that kind of safe way to say, hey, I think I got a raw deal. And if we can do that, Madam Chair, I think.
Sure. And we have a Commissioner's Action Response Office, and I recognize that not everybody feels confident coming directly, but we certainly, we get our fair share of folks who definitely feel that they can reach out to us and deal. And I also welcome Councilwoman Bass and the entire committee. If you, as much time that you would like to spend at DHS in terms of the different facets, we absolutely welcome you.
Thank you so much, Madam Chair.
Thank you. Thank you. And I do want to note for the record that the Commissioner has been more than interested and welcoming, and has expressed, you know, many invitations for us to come over and visit, particularly in the last couple of weeks as we, in the lead up to the hearing, to you know, come over and to see. But you know, it has been my policy that once we ask for a public hearing, that we not have sort of like a you know, a private meeting before that public hearing. So now that we're in the process of having the hearing, I look forward to having an opportunity to come over and spend, you know, all day over there with you.
Great.
So, and the whole committee's coming, everybody's
Awesome.
coming, right? We got plenty of time. Councilwoman Gim.
Thank
Let's
you
do it
very
tomorrow. No, just kidding.
Thank you very much, Madam Chair, and I also want to echo the councilman's compliments for taking on a very difficult issue and also being able to bring together a lot of our providers in the same room along with the families that they serve. I think that this is a really important way for us to get to understand and get our heads around a very complicated situation. Councilman Jones, we definitely want to work together on the residential treatment facilities and the work that we've been doing to get the school district and get some clarity. We may need to do some work with the state, actually, to clarify better communication between the state, and I know you'll be a great leader on helping us navigate some of that, so thank you very much. You know, I wanted to first say that we would really like to see the truancy report as well, to have a pretty in-depth dialogue around that. I think when you did some of the public hearings around the improving outcomes for children IOC, a number of advocates, myself and others, wanted to better understand and peel back the truancy issues. It's an issue we're dealing with the school district. It may be something that we're going to ask them to take on as a much more serious investment in terms of staffing and resources. But clearly, the consequences are significant for truancy, and they're a serious indicator potentially about other issues that we need to use to help children, but we don't want to leave it just at truancy if there's more significant issues at play. So I'm going to do a little bit of a in the weeds dive about some of the narrower aspects of the CUA report card. A couple of questions that we had that I had have to do a little bit about some testimony that had spoken to the fact that CUA workers feel uncomfortable with courtroom testimony and struggle to implement some of their court orders. All but 2 of the CUAs received 2 bells in the courts category, so this clearly needs to be some area of engagement. So I'm curious about what DHS is doing to educate and train both the CUA staffs as well as the courts about what needs to happen so that we can improve this process a little better.
So, excellent question, which also, one of the great things about this being a long process to get to the baseline and releasing that was that there was nothing that was a surprise to anybody, right? So we were aware of challenges as we were looking quarterly until we released the annual baseline, and we knew that court representation is an area that we had improvement. So before the baseline was issued, DHS enacted a court-simulated training program, so where we actually put new social workers through what would be a case-like experience in front of a mock judge in physical chambers, because we recognize it's one thing to get a training on a process or be told what it'd be like versus actually sitting in front of a judge and being prepared for that case. So that's one thing that we put into place quickly as a result, recognizing that it was an area of improvement, and recognizing that it's a challenge and certainly can be intimidating for folks who have not had the same level of experience.
Yeah. So I know I'll be looking forward to hearing other of the providers who come forward to hear if there are other suggestions that they have about how to better navigate some of that stuff, because we'd like to see that improve. They have a major role to play, and the courts need to be able to hear clearly from multiple positions about what is the perspective on the particular situation. I know earlier you mentioned that DHS has never really had, before the CUA scorecard, there was no such thing that was kind of applied to DHS. But I am kind of curious because DHS does run a number of different systems and that interface with our...
Point of information. I need to offer up a clarity. I don't think you were here, Councilwoman Gim. The history is very important, and the facts are that it was under Mayor Street with the assistance of Naomi Post Street, who traveled to 4 cities around the country and either discovered or developed or were informed by how those systems were operating that led to a report card during the street administration. And then when new leadership moved to the 2nd floor, they had other ways of how they wanted our systems to operate. And now under Mayor Kinney, this practice under the Commissioner's leadership has been redeveloped. So I just think it's very, very important that their institutional knowledge has a purpose, and it has value, and I believe we need to offer up credit, and sometimes credit that's not worthy, to those who try to make a difference in the lives of children.
Yes.
And the record needs to reflect that under Mayor Street's leadership and Naomi Post Street, much was done, not in a vacuum, but looking at how other systems were operating around the country to come up with what was known as the report card and now known as
Well, that was the children's report card, correct?
Children's Report Card.
Thank you very much,
Yeah.
Councilwoman.
And
Thanks
each year,
that
for
point of
8
clarity.
consecutive years, a document was produced that looked at metrics like truancy and other things.
Thank you very much
You're
for that point of clarity. I think what I meant to really focus in on is the fact that the KUA scorecard, I'm curious about whether, as it looks, as DHS looks at its providers, whether you are also looking internally at some of the services that you provide
Oh, yeah.
that interface directly with our providers. So some of the things include, things like the hotline, intake, central referral units, adoptions. We've talked a little bit about the process in which students who are aging out of the system are able to achieve sustained independence and stability in their lives. So is there some kind of internal way in which you're reflecting? So I know we're talking about the scorecard, obviously, but there are a number of areas in DHS that feel like they need some clarity from our end for clarity of review.
So I'm appreciate the question, and I'm also very appreciative that we're so aligned in what we've been thinking. So we understood that the most significant issue when we were coming in this administration was answering the question of how are the KUAs performing, and not just giving an anecdotal response, but the other question is how is DHS performing. So we have quarterly metrics that we now put on our website. If you go on our website, you would find this report, some of the slides that I've shared with you. But we have a plan for doing sort of a scorecard evaluation through DHS's departments, and we've already initiated. I think it's been very important to us that we have quality data, so we're measuring accurately in terms of where we are versus progress. And it's our intent that the KUAs are not the only providers that we'll be looking at in terms of evaluating from a similar metrics. So we actually have that already moving in place for some of the internal departments, and we'd be happy to walk you through sort of what that timeline looks and which departments we're doing first.
And are you taking like external feedback to weigh in, so it's not just a wholly internalized process?
We want to mirror what we did with the KUA scorecard, which is there was a lot of stakeholder engagement and a lot of review and discussion and vetting with the KUAs for the KUA scorecard. So if it's, for example, intake and investigations, one area that we're looking at, we would involve staff at DHS, of course, that does the work, but we would want to also have other stakeholders provide us feedback on that process. On the provider, we do monitoring and evaluation of providers every year, but we really want to sort of kind of revamp how we do that so that we can actually have also a report card for other providers that are not KUAs. And we absolutely have to engage them in the process. So the planning is just beginning, and there will be like a schedule of engagement, like similar, given the lessons that we've learned and how, even though it was difficult, it was a really collaborative process to put together the KUA scorecard. That's how we want to go about our other areas of service.
Sure, and I'd love to see, as you kind of evolve that, particularly around the intake and investigations. Yep. I had two more areas to ask about very briefly. One is, in the last fiscal year, DHS had 86 bilingual employees, which does help us understand a little bit, because we have and serve so many families that don't speak English as their first language. But I'm curious about whether you're evaluating the level of language access at the different KUAs and whether they're getting the kind of supports that they need. We've had a number of situations that families contacting us about intense amounts of confusion if the families don't speak English, about folk art practices, home medical practices that are perceived as being abusive. So, if you could talk a little bit about, what are the translation and interpretation services that are being offered at KUAs for limited English speakers or families whose home language isn't English?
So I'll start first by saying I think that this helps us think how we continue to evolve. So in working with Councilwoman Blondell Runner Brown, she was really concrete about these are things that are important factors to enhance diversity, and so leadership, board, where we spend our monies. And I think we then created those benchmarks and said we need to improve from where we are. So likewise, I think digging deep just to be able to say where are we in terms of language, like we can answer for DHS, being able to answer that for the CUAs, and then what's reasonable or where do we need to be. So I take that on as a responsibility that we would report back to you. The majority of folks use what the city has, whether it's a language line or if they're engaging. I can't answer for every single one of the CUAs, but I will get that answer back for you in terms of what are the services they're using, or their particular contracts they're using, and how they're managing it on a case-by-case basis.
Yeah, I mean, I think Language Line is a supplemental service, but
Absolutely.
when we're dealing with evaluations of home and safety, when we're looking at complicated issues about family relationships, I'm not sure that you can just do a back and forth phone thing with somebody.
I agree.
And again, I'd like to hear from the CUAs about the needs, but it seems like there have been some concerns raised, even just about the major language spoken here in the city, which is Spanish, that there seems to be a lack of language support even in Spanish for those families. So if there's a way that you're evaluating it and and asking the CUAs themselves about how they are providing it and what they need in order to provide that better. And then the last area that I wanted to ask about was an area that I talked about with Ms. Shapiro when she was the interim head. But we've been talking a little bit about, first of all, thank you for reducing the caseload for providers from a significantly larger number and driving towards the 10-to-1. I know that in a couple of testimonies from some of the providers, I visited CUA 9 recently, that caseload is still significantly higher, and we're trying to understand that better. But one of the questions that has come up and that I raised earlier has been, you have one family, one case, right? So it's not just that there's one case equals one child, one case equals the family supports that go along with the child. And I have asked before about, the children are included in that understanding of the case, but can the CUAs be capped at a certain number of children? I mean, we can hear a number in which we all understand that part of the issue we're struggling with to provide better services is that we can't have too many cases assigned to a worker. Now, 10, on the face of it, sounds fairly reasonable, except the fact of 10 can include as little as one child in one case, which is great for that, direct service. But it can include as many as a family of 10 that are extremely high need. And so a caseworker gravitating between anywhere from 10 to no maximum at the end is a big question. And I guess, as I said, I asked this before about whether there can be a combined sort of cap. So 10 caseloads or X number of individuals under one family. And I would leave that up to you, but my assumption would be that it wouldn't be 100, that it would be something significantly below that. Recognizing we still want to keep the families as a case group, but once we start to tip into numbers that are just simply unreasonable or unmanageable, we really need to not look at it solely as a caseload, but as a maximum capacity of individuals under one workers' care. Is that something that you're open to talking about?
It's a discussion that we've had, but I think that it's an excellent, it's something that has come up, and certainly getting to our goal of 1 to 10, it would be great if we were lower than 1 to 10 and then not have the state reduce what that amount is, would be my overall preference. A combined cap is something we can certainly talk about, but I think it has to be in partnership with the CUAs because we have had this discussion and the discretion of how they assign cases happens within the CUAs. Okay. So I don't say you, case manager Susie, case manager Maria, DHS does DHS hands the case over, and then the CUAs determine which case manager they're giving their case to. So this is one of those places where, just in all honesty, we're trying to figure out what's the flexibility you give to a CUA to operate independently, and what's the point in which DHS sort of comes in and says, no, we need to do X, Y, and Z. And I think this is a perfect example of where we could do that in partnership to figure out what makes sense and is reasonable within each CUA.
Yeah, and I'd love to hear what the progress of that is. That's all for my questions right now. Could I do one PSA? One very brief public service announcement, because we have so many providers here in the room. I had a chance to visit one of the CUA 9, and one of the things that we talked about is that so many of you providers in the room are dealing with housing. And housing instability issues. So the city of Philadelphia has put in a huge investment this cycle to really invest around anti-eviction work. So helping your families who are potentially facing eviction in landlord-tenant court. And one of my staff will be passing around some information around it, but I wanted the folks in this room to know that currently housed at municipal court and landlord-tenant court, if you have a family that is dealing with eviction, there is a lawyer for a day pilot that will provide free legal pro bono services. There's a tenant help center that is full-time staffed. There is a court navigator that can help families deal with how to go through the eviction process so that they can get the supports that they need. There's also financial counseling, and then for all the providers in this room, there's a live tenant assistance hotline. So you don't understand this process, your families are dealing with it, you can call the tenant assistance hotline to get some supports, and we'll be passing around information, but I hope that this is something that you can share with your families, your workers, and that this is an issue that the entire City Council of Philadelphia is really invested in, because we know that's, there is a point of safety and permanency in which the child's dealing in an abusive situation, but we want to separate out the safety and permanency that has to do with a loving family that is housing unstable. And we need to tackle and separate those two, and the services that we can direct towards those is what we're trying to help. So I hope that helps some of the providers in this room deal with some of the situations they may be facing. Thank you very much, Councilwoman.
Thank you, Councilwoman. Councilman Green?
Thank you, Madam Chair. I just have a few quick questions, follow-up. My understanding that over the current or past fiscal year, DHS had done significant number of hiring.
That's correct.
And what areas were those hiring in?
So I could have our personnel, but it was close to 100. So when I came in, there were a number of significant vacancies in key areas of the department. And as we had talked about the need to revisit the front end, we hired multiple classes, some of the largest classes that had been brought in about 3 years.
And what were those positions for again? I'm sorry.
So social workers, front end.
Social workers, but front
So
end,
hotline investigation, yes.
Okay.
And I believe we were close to 100, if not.
Right. And that's that strategy to deal with the backlog on the hotline?
I got confirmation it was 100, yes.
Right.
And we've also we've increased the hiring for our juvenile justice facility as well.
And that was to provide additional resources for the hotline issues that have been occurring?
Exactly.
Okay. Also, I just wanted to follow up on some questions that were asked earlier. It seems to be an issue of empowerment for a number of families in reference to dealing with DHS. I see this in other areas, especially in the autism community as well as in the aging community. And I know, for example, in the aging community, PCA has an ombudsman process where they work with people at senior centers. So if you have an issue or concern, there's an ombudsman that can provide information to you that empower you. So if you have questions and concerns, there's a independent third party, especially in the aging community where people are afraid that in a senior center, if they speak up, they may get additional abuse. So from that perspective, is there any conversation or any concept of providing, because it seems like communication, once again, is a concern,
Sure.
not providing information, well, parents getting information maybe by way of a letter, but not really being empowered on how to access information and really know what their rights are. So have you seen that in other jurisdictions where they've had some type of ombudsman or third party or some that's still funded from the agency that goes out and empowers parents and saying, listen, yes, you may have received a letter saying what your rights are, but this is how you navigate those areas.
So I don't know off the top of my head if there's another jurisdiction that has something similar to that, and I can certainly, that's a great thing for us to follow up on. I do know that the Auditor General, Eugene DePasquale, did bring this up as an issue at the statewide level, so I know that it's not a consistent practice throughout the Commonwealth that there is a position. I'm not as familiar with PCA's ombudsman, so I think the first thing I would do is sort of understand how that looks and operates, because you're correct. We have an office that's part of the Commissioner's office that responds to complaints and concerns, but it's still in my office. So it's certainly something that, using PCA example and maybe talking with the state, something that we should review.
Okay, thank you. Thank you, Madam Chair.
Well, thank you so much for your testimony. I do know that Councilwoman Blondo Reynolds-Brown had an additional question, but she had to step out for one moment, so she will be back. So if I can ask you to stay
Stick
close?
around. Yes,
Okay,
of
if we
course.
can have the
Absolutely.
clerk call the next panel.
Dawn Holden, Chief Executive Officer, Turning Points for Children, and Samea Kim, Associate Director, Pennsylvania Council of Children, Youth, and Family Services.
Good afternoon.
Good afternoon.
Please state your name for the record and begin your testimony.
Dawn Holden Woods, Turning Points for Children. Good morning, Councilwoman Bass and other members of this committee. My name is Dawn Holden Woods, and I'm the Chief Executive Officer of Turning Points for Children and Managing Director of Child and Family Services for PHMC. Councilwoman Bass, thank you for inviting us here today to discuss our partnership with DHS and other city agencies in assuring the safety and well-being of Philadelphia's most vulnerable children and families. We greatly appreciate the opportunity to offer clarity on our work and to share an update on the progress that's been made following the launch of the CUA Scorecard. Today, I'm here to provide a view into the complex and challenging world of Philadelphia's CUA system. Thank you to the members of City Council who have spent time at any of the community umbrella agencies across the city to better learn what we do and to meet the passionate and talented individuals who work on the front lines every day and the many children and families with whom we work. The doors of Turning Point's 4 community umbrella agencies are always open for additional visits and conversations with council members and staff who are interested in learning more about the challenges and successes of child welfare work in Philadelphia. Turning Points for Children has been caring for children for more than 183 years. As one of the earliest to support the Improving Outcomes for Children initiative, we recognize that the community-based approach to child protection envisioned by IOC required a commitment to apply 21st century solutions to the age-old problems of child abuse and neglect in Philadelphia. Long before the RFPs for providers were issued by DHS, we used our own funds to visit other jurisdictions that were implementing similar approaches, not only to review how they did the work, but to learn how they measured their effectiveness. As the then CFO of Turning Points, I helped lead the efforts to replicate the most effective aspects of what we learned, and I'm pleased that the initial results of the DHS scorecard affirm that we have been achieving comparatively positive results. Turning Point stability and strong back office infrastructure allowed us to assume responsibility for 2 additional community umbrella agencies through the acquisition of Wordsworth. These include CUA 5, covering parts of Upper North and Northwest Philadelphia, and CUA 10, covering parts of West Philadelphia. With the acquisition, these 2 CUAs, and most importantly, the children and families served within these CUA regions, experienced seamless service continuation and no disruption in operations during this acquisition. Since the inception of IOC, we have been managing CUA 3 in the lower northeast and CUA 9 in west southwest Philadelphia. With these 4 KUAs, Turning Points is now responsible for providing intensive case management services for more than 5,500 children, of whom about 56% are in foster care, with the remainder receiving in-home support. In partnership and under the leadership of DHS, we are responsible for assuring the safety, permanency, and well-being of the city's most at-risk children and families. The KUA model, to keep children and families as close as possible to their neighborhoods, is rooted in an evidence-based approach. This approach has been determined to be less disruptive, to minimize trauma, to maintain a child's continuity in community, school, and with relationships, and to increase family member involvement. There is a greater connection because work is localized, and we do better with placing children with family members. 46% of the children we place now are in kinship care. In just this past week, we aided a family living in a condemned property with several young children with no utilities or facilities for cooking or bathing. With our help, they were able to connect with other family members to provide safe homes for their 3 children while we work on a more permanent solution. We assisted a family unable to provide healthy food for its 5 children with our Food and Wellness Network, which operates food banks in 2 of our 4 KUA areas. And we connected another family whose son battles severe mental health issues that put both him and his family at risk of violence to behavioral health service. We put both him and his family at risk of violence to behavioral health services within our network of programs. We regularly intervene in situations driven by physical, sexual, and psychological abuse where a parental mental illness or other disability threatens the future of vulnerable children. Across our KUAs, caseworkers are responsible for between 10 and 13 cases. In each of these cases, our case managers are the single point of contact for the families they serve. Every day, for each child in each of these families, the case manager must assure the child's physical and emotional safety, support academic and other education-related progress, assure medical, dental, and behavioral health needs are met, transport the child when necessary to and from school and appointments, supervise visits with family members, make sure foster parents have what they need to care for the child, help birth parents and other family members obtain the often wide range of health, social service, and other practical services they need to be able to reunify with their children, and identify other family members and community supports, all while acting as a mentor, a counselor, a trusted friend, committed to keeping the family together against incredible odds. We are grateful for the vision and leadership of Cynthia Figueroa, Commissioner of DHS, as well as the extraordinary leadership team she has put together to assure that the mission and goals of the IOC project are met. After several years of unpredictability, we are moving towards stability. Since taking the helm, she has been able to begin to reduce caseloads and work consistently with us to address challenges and roadblocks that are inherent in a large and complex initiative such as IOC. One of the most important initiatives of Commissioner Figueroa and her team has been the implementation of the KUA Scorecard, which on a quarterly basis helps the KUAs track their performance in 7 critical safety, case planning, and practice areas. In the scorecard results for the baseline year of fiscal 2017, 3 of Turning Point's 4 KUAs ranked in the top 4 spots, with 1 ranking first among the 10 KUAs. KUA 5, which is almost twice the size of other KUAs, ranked 9th, and is already showing good, steady, positive progress since the release of the scorecard last year. The detailed performance data provided by DHS through the scorecard and various other monthly reports have become critical to KUA efforts in improving results for children and families. Prior to Commissioner Figueroa, this information was not available to KUA providers in the same way it is today. DHS' commitment to streamlining the approach in a more efficient way allows for greater transparency. Equally important to the data provided by DHS is the collaboration, partnership, and tools needed to address underlying issues and work with our teams to improve them. This regular access to performance data allows us to target our resources to areas needing improvement and to track our progress. Each of our KUAs has identified specific practice areas to focus on and has developed specific action plans to address the performance issues. For example, in one of our KUAs, the successful completion of weekly visits of families receiving in-home services lagged behind requirements. Within 2 periods, that percentage increased considerably. We still have a long way to go, but because of the scorecard and our own quality improvement efforts, we have seen the practice begin to improve significantly. As you know, there were many implementation challenges in the first 3 years of IOC, largely having to do with a significant increase in the number of children in foster care and largely static funding from the Commonwealth. We believe that today, the IOC initiative is achieving results that are as good or better than what was being achieved under the old model. Despite the challenges shared by every urban child welfare system in the nation, we are making clear and measurable progress, and the transparency of the accountability systems put in place by DHS will assure that we continue to do so. Today, almost all CUAs meet expectations in terms of quality and timeliness of documentation. Almost half of all children in placement are living with other family members rather than strangers. We are being thoughtful about keeping children in their schools and neighborhoods when it is safe to do so, and we are keeping siblings together more and improving rates of permanency and safe case closure. Today, we are 1 month past the official legal transaction date of the Wordsworth acquisition. We recognize that there has been some confusion over the distinction between the residential treatment facilities, or RTFs, and our CUAs. This confusion has led to a level of concern among some council members. To offer clarity, the RTF that had been operated by the former Wordsworth entity was closed and no longer operates as of November 2016. There are no legacy RTF employees working at any of our 4 CUAs. Turning Points for Children does not operate RTFs and has no plans to operate them in the future. Licensing and oversight of RTFs is handled separate and distinct from CUA operations. Today, as noted earlier, Turning Points for Children operates the 2 former Wordsworth CUAs along with our 2 existing CUAs. Unlike RTFs, which are residential placements for youth with serious behavioral health issues, CUAs serve as a case management function focused on assuring that families involved in child protection services are able to obtain the services and supports they need to either have their children returned to them or to prevent placement in the first place. Our teams worked in close collaboration with one another and with DHS in the months leading up to the acquisition. We worked hard to ensure continuity of service and operations as we managed a complicated legal and financial process. Through the 6 months leading up to the close and in the first month of integration, we've seen no disruption to operations. Our team has begun to aggressively execute a plan that looks to unite the 4 CUAs, ensure capacity building, shore up technical assistance, and establish a system-wide approach to integrate 4 CUAs into one coherent whole. Again, it's critical to note that during the first month of integration, we've maintained continuous service to the children and families served. In addition to consolidating functions such as human resources, purchasing, and information technology, we are reviewing policies and practices to ensure consistency and have developed mechanisms to learn what's working best in each CUA so we can assure that those best practices are adopted across our entire CUA network. We are in the process of developing an intensive, ongoing professional development plan that we believe will not only continuously improve the quality of our work, but improve rates of staff retention. And perhaps most importantly, we have consolidated our quality improvement and quality assurance efforts into one department, ensuring consistency of practice and policy, and giving priority attention to making immediate progress in those areas where the scorecard indicates that urgent improvement is needed. Just last Thursday, we convened the leadership of our 4 community advisory boards. These groups are an essential component of IOC, required by DHS guidelines to assure community input into CUA programs. At these meetings, we look to maximize the advisory board's ability to provide oversight to our activities, ensure that we are aware of and accessing neighborhood services, recruit foster parents, and ensure our CUAs remain in touch with the major issues and concerns related to children and families in the neighborhoods that we serve. Ultimately, our CUAs will only be successful when our services help reunify families and help children be adopted when reunification is not possible and prevent placement of children and families receiving in-home services. Our daily pledge is that we will do everything in our power to keep each child in our care safe and well, and assure that our staff members have the support they need to handle the enormous stresses that face them 7 days a week. 14 years ago, I left my career in corporate America to dedicate myself to work that has a real impact on the quality of life of Philadelphia's children. I didn't make that choice only to fall short. We welcome the high expectations that councils and others place on this work. We owe it to Philadelphia's children to be held to the highest standards possible, and we believe the implementation of the CUA scorecard is instrumental in providing a roadmap for our forward progress. These high expectations are what drive the new accountability and transparency we have seen in child welfare operations over the past year. We may never be perfect, but we should always be moving forward in clear and measurable ways. That is Turning Point's commitment, and more importantly, my personal commitment to DHS, to City Council, and to the families of Philadelphia. Thank you for your time and attention.
Thank you very much for your testimony. And can we come
Please, after you. I have questions.
Okay. All right. And Councilwoman Brown.
Yes, thank you, Madam Chairwoman. Good afternoon. Good afternoon. I'm rushing ahead of myself. And thank you for your very well presented testimony that really encapsulates where you've been and what your vision is for the future. You mentioned on page 5, first paragraph, and I should just say for the record that I have had the opportunity to visit Turning Points there at 40th and Market, and because of what I observed, I then required my staff to spend time there so that we can see up close and personal the work that you're doing on a daily basis to make a difference in the lives of our city's children. Having spent some time at family court working with probation officers, I thought it appropriate for my staff to see up close and personal the magnitude of the work that you do. And so with that said, on the page 5, top paragraph, you say you are shoring up technical assistance and establishing a system-wide approach to integrate the 4 CUAs. Speak to that in terms of what strategies you're using to shore up the technical assistance.
Well, the first thing we've been working towards is reviewing all of the cases, both current active cases and prior reports of all of our CUAs, but most especially the new CUAs that we have just acquired, to see where the service delivery gaps are. I mean, the scorecard, as Commissioner Figueroa mentioned, is a roadmap, but once you get into the weeds is really where you identify where the practice areas of concern are and where we should really work with staff to get better. And so we've been spending a fair amount of time with all of the leadership of all 4 CUAs to figure out what next steps look like in terms of tackling the practice areas that we are concerned about. And obviously our top concern is safety, supervision, and staff turnover. Those would be some of our core areas. The other thing that we've been doing is trying to really work on morale. I mean, anytime you've been a part of an organization that's encountered a public tragedy and gone through bankruptcy, staff are tired. And so we want to make them feel at home and let them know that this is a place that is safe. And so we've been also offering leadership development training, because in the social work field, we spend a lot of time on the compliance standards, but we don't really talk about what it means to be a leader and what those expectations are.
Right.
And also explaining what the culture is of Turning Points for Children and how we want that to translate into the behaviors for the staff who work with us.
Surely. Thank you also for the clarity on the RTS, residential treatment facilities. So then who funds, if they're not a part of the CUA system, and then who funds them?
The
Is the
behavioral
city,
health
is the
system,
state?
the behavioral health system funds the RTFs. Again, Turning Points does not operate an RTF,
Right.
but behavioral health is paid for by behavioral health.
And those dollars come from the state. Is that correct? Help me out.
That would be correct.
Okay. So, as DBH or
CBH.
So then with that said, then is it fair to then look to CBH to find out where the gap, for lack of a better word, happened with regards to the unfortunate circumstance at Wordsworth, so that we're actually placing the apples where they need to be, or putting the apples in the right basket?
So if I can so politely jump in here, again, Commissioner Figueroa. So to make matters more complicated, the source by which it's determined that a young person goes into residential treatment facility has to happen through the behavioral health process, and it is predominantly almost 90% paid for, especially Philadelphia-based kids, out of CBH dollars. The facility is licensed by the state for the Office of Children, Youth and under the direction of the Office of Youth and Families through what's called the Bureau of, I am totally blanking on the name, I know the acronym, but I want to be clear though and transparent in that there is a very small contract amount that DHS pays for what we consider room and board, which is a very small amount. So that supports obviously when we place our kids there, because not all children who are in RTF are under DHS's custody.
And I've followed that so far. What percentage of children now are placed out of the county for RTFs?
2% are out of the county, or 2% of the DHS population. I would have to get that further broken down in terms. Right now, there's no RTF in Philadelphia County. The closure of Wordsworth Academy ended any residential treatment facility in Philadelphia County.
So translated, that means that there are no CUAs that are operating RTFs in the county of Philadelphia.
That is correct.
Okay. And is it fair to say then that the, I'm looking for a delicate word here.
Yeah, I'm okay.
Some might call it noise, others might call it publicity, rightly or wrongly, regarding the tragedy at Wordsworth. Those dots would lead to CBH.
So what I would say is the dots lead to all of us. We failed that young man.
And because of maybe gaps in linkages talking across systems, or what?
Well, and I want to highlight a few things, and this again, not publicity, not excuses. That young man was not in the custody of Philadelphia. He happened to be in a facility where we had other Philadelphia children.
I see.
He was placed there independently through his family and was from another county. We immediately determined that we needed to move the children from that facility based on that tragedy.
The Philadelphia children from that facility.
That's correct, and I think that's why it's been difficult for Philadelphia County to answer the connect the dots on the accountability measures, because there is a state licensing, there is the behavioral health, and of course then there's the DHS factor. In this particular case, we had no involvement with that young man.
I see. Okay, that clarity is important as well. Back to the last page of your testimony, speak to the how with regards to the recruitment of foster parents. How that happens currently.
Good afternoon, Councilwoman.
Good afternoon.
David Fair, Deputy Chief Executive Officer for Turning Points for Children. Recruitment of foster parents happens in a variety of ways. Probably the most effective way is word of mouth. A foster parent who has a good experience with an agency providing foster care tells her friends or his friends and others, and they join the team. We also do a lot of community outreach events. We have events in libraries and in community centers throughout the city. All of the CUAs are funded to provide, we all are provided funding for 2 staff who do nothing but recruitment of foster parents for the foster care agencies. DHS has just started a new campaign, media campaign around recruitment of foster parents, which we think will help a lot as well.
Effective to be released when? The foster parent campaign?
February 26th.
Okay.
Additionally, Turning Points has been doing some awareness building as well, and so we've been partnering with one of the restaurateurs that owns 5 or 6 of the restaurants on 13th Street. Well, you will also see cards in every check presenter, which is also a foster care campaign for Turning Points for Children.
I see. What about outreach to various clergy communities?
Yes. Well, I talked about community organizations. I'm talking about faith organizations as well as sororities and fraternity events and
So that's done in a
things of
very
that nature.
strategic, intentional way, reaching to...
Absolutely, absolutely. And the advantage of the coup is having regional focus in the city with certain neighborhoods and certain police districts allows us to develop ongoing relationships with people in those communities, which has helped a lot in recruiting foster parents. Turning Points didn't have a foster care program before it opened the COAs. We opened our foster care program and got licensed about a year into the COAs. We now have over 600 foster parents.
Is there
Most of whom are kinship parents or relatives of the
Okay.
children who are in care.
Okay. And what is that number today as we speak, the number of children in foster care?
About
Relative.
6,000, I would say.
Okay.
Yeah.
All right, then. Okay, that concludes my questioning, Madam Chair. Thank you.
Thank you, Councilwoman. Ms. Kim, would you like to state your name for the record and begin your testimony?
Sure. My name is Samea Kim from the Pennsylvania Council of Children, Youth, and Family Services. Good afternoon, Chairwoman Bass and members of the Public Health and Human Services Committee. Thank you for holding this hearing and for inviting us to testify on this important topic. Again, my name is Samea Kim, and I'm the Associate Director of the Southeast Office at the Pennsylvania Council of Children, Youth, and Family Services. PCCYFS is a statewide association of private provider agencies that provide child welfare, juvenile justice, and children's behavioral health services. We have about 100 member agencies statewide and about 30 in the Philadelphia area. PCCYFS has worked alongside the Department of Human Services during the development of IOC, and we believe the community-based service design can be effective for Philadelphia's children and families. We also want to affirm that we support the development of CUA scorecards as a mechanism for accountability. Through the scorecard, DHS Commissioner Figueroa and her team have taken difficult but important steps towards improving transparency in their child protection work. What the baseline scorecard sets out to do, however, is an extremely challenging task. This system has continued to evolve at the same time that the CUAs are being evaluated, and two, the work exists in a system, so some of the outcomes we find are not the exclusive responsibility of the CUAs. Since Commissioner Figueroa's appointment, she's directed some very important and necessary reforms that you've already heard about. For example, she's transitioned CUA subcontracting back to DHS, where there's greater administrative capacity. Child placement and replacement referrals have returned to the DHS Central Referral Unit, and CUA caseload sizes have improved to 1 caseworker for 11.5 families as of September 30th, 2017, with a commitment from DHS to fund caseloads at a ratio of 1 to 10 families. Similarly, although IOC was formally launched in 2013, it has seen system changes almost every year since, which presents a challenge for the evaluation of an entity's work. For example, as soon as all of the CUAs were operational in 2015, the size of the system, originally designed for 4,000 children in out-of-home care, ballooned as a result of law changes to what is now close to 6,000. Understandably, this unanticipated increase put a strain on the system, to which CUAs were still responding between 2016 to 2017 and even today. It was not until 2016 that the city committed to increasing funding to help CUAs with their unmanageable caseload sizes, and not until 2017 that the workforce was sufficiently trained that we began to see decreases in the workload. However, there's still much opportunity for improvement, as mentioned before, since the current caseload ratio of 1 to 10 families still means each CUA caseworker is managing an average of 20 to 27 children. Additionally, not everything that the scorecard seeks to measure is exclusively under the responsibility of CUAs, and the scorecard could better represent the fact that shared responsibilities deliver these outcomes. For example, as I mentioned earlier, DHS now manages intake and referral of children. Therefore, whether a placement is in the least restrictive environment and within the CUA community are out of CUA control. Also, because CUAs are no longer managing placements, CUAs and providers may not immediately have the information about a child to make informed decisions about the child and family's needs. Looking at the work of CUAs in isolation does not fully explain how the work is advancing, since really the effort is systems-oriented. We think the scorecard could better reflect how one entity's performance impacts the performance of another and acknowledge that the accountability is shared. Looking ahead, DHS has also expressed an intention to expand their performance accountability to include scorecards on additional types of providers with which they contract, and ultimately DHS plans to release a DHS scorecard. We commend the idea as a clear commitment by DHS to transparency for the city's most vulnerable residents. Again, without a full system perspective that exhibits shared accountability, the report cards are not as effective as they could be. Finally, as the scope of this hearing also includes the exploration of a quote-unquote practical plan to improve outcomes for our children in the DHS system, we believe it's important that we do so with the full system in mind. While the scorecard deals with COAs specifically, there are a number of providers who work directly with DHS and COAs and are critical partners to achieving better outcomes for Philadelphia's children. Unfortunately, they haven't had the full opportunity to participate in ongoing conversations about how the work is advancing. Any ongoing work must be reflective of and informed by the full system and therefore include these providers. Ultimately, the work of this system and any accountability structures must be able to answer whether the structure results in better outcomes for children. And we thank City Council for continuing to advance these difficult conversations for the benefit of Philadelphia's children and families. Thank you again for the opportunity to offer comment. I'm happy to answer any questions you may have.
Thank you so much for your testimony, Councilwoman Quinones-Sanchez.
Thank you. I have a point of information for the commissioner, because we talked about the providers managing the residential treatment services, and you said there's no CUAs managing
RTF, correct.
And so who manages the bridge in my district?
Oh, so the bridge is an affiliate of Philadelphia. It's affiliate of you guys?
So it is, go ahead, can you please clarify for the record?
For the record, the bridge is a congregate care facility, which is different in terms of level of care than the RTF. It is managed by Turning Points for Children.
Okay, just want to get that clarity, so we do have that. Okay. Congregate care is children who, this is the initial intervention. You can.
It's where there isn't a kin or a foster home, and there's a different need for placement. So we're not able to keep them in a home-based care. And in those particular, DHS pays for the totality. So it's not a behavioral health intervention.
Okay.
If I may add, the only difference with the bridge is that the facility part of it is specialized. So most of the kids that are referred are there because of substance abuse challenges and are referred through CBH and paid for by CBH. We do have a small number of beds also in that facility in a separate section that are for DHS kids. And that's considered our Villa program, but they're both housed at the bridge.
Right. So I just wanted to clarify this because we do have some dual management system stuff, and I do get an opportunity to go visit there, and I think the work is adequate. Although I'd like to see more coordination in light of the fact that there is co-management, particularly as the additional the unit that was created in the back, or the additional unit, when we cited that there, talking about difficulties of citing, when we cited that there, that was not the initial commitment that we made to the community. And so one of the things that I think it's important, because these become controversial, right, about where we locate them and stuff, is that there, at some way that we update the community about the services being provided there. They're very much necessary. Most of the kids come from those zip codes, I believe in those services, but I do want to make sure that we made a commitment that one service was going to be provided, and it's kind of evolved, that we have some sort of mechanism of keeping folks informed. Okay. With that, let me talk a little bit about just, these are kind of yes, no's, a little bit more. Can you explain the acquisition of Wadsworth in legal terms, and then the financial transaction?
So I will speak to just the CUAs. Wordsworth, the former Wordsworth entity, was comprised of multiple entities. There were actually 3 separate legal entities. Each CUA had its own entity, and then there was a third entity which housed the school, the RTF that was closed, and other Wordsworth programs. So what Turning Points has acquired is specifically the CUAs. Financially, all that means is that we have acquired the existing contract that DHS had in place with the former Wordsworth entity is now being assigned to Turning Points. Any funds that were already spent are spent. There's no more money being allocated to us as a part of this transaction. We are just picking up and billing for our services for the remaining 6 months of the contract period.
Okay, so there were no assets, nothing transferred. It was just the contractual piece of it.
Correct. The only thing that transferred were the KUAs, and any foster homes, since Turning Points also runs foster homes, any foster homes that were associated with Wordsworth were transferred to Turning Points, and we notified the foster parents a month in advance. They were given the opportunity to move with us or any other entity that they wanted to associate with. But that is it. There's no other financial transaction associated with it.
So how many of those were in that pool? You said the
Foster homes? I would say approximately 100 homes.
Okay. Can you explain the legal and financial relationship between Turning Points and PHMC?
Certainly. So Turning Points for Children became an affiliate of PHMC in 2013, in February of 2013, and just a little bit about our decision. So we've been around for over 100 years at that point in time, and we believe that in order to do this work well, we wanted access to a more sophisticated back office structure than what we could currently provide. So at the time, I was the CFO, I managed the janitor, I managed the IS guy. I mean, I had a hybrid of roles that probably weren't necessarily the best fit for a growing organization. And so we affiliated, and what that means is we have an agreement with PHMC for services that we purchase from them. So for instance, IT services, we don't have IS staff on site. We purchase those services. When we went to move our KUA, we used their real estate expertise because we don't have anyone that's on site to do those things. We leverage their general ledger accounting system, so we use the same package. So that's how it works. We have an agreement.
So you purchase those services?
Yes.
So that means you have an independent board?
We do have a board, and we have an agreement that's in writing in terms of what services we purchase from PHMC annually.
So does Turning Point have any board representation at PHMC?
Currently, PHMC has 2 seats that they're able to fill on the Turning Points for Children board.
So it's the other way around. PHMC fills your board. Do you have the ability to fill their board?
We have 1 Turning Points board member that sits on the PHMC board. So we have a board of about 18 people. 2 seats are allocated for PHMC. At some points in time, they've been filled. Some points they haven't been. And then Turning Points, our board chair, also is a voting member of the PHMC board.
Okay, so they govern you, not the vice versa?
Vice versa, meaning we govern them.
Or you have a say in their governance structure?
Or I would say we have a voice at the table along with other board members.
And the reason I ask that is because one of the things you mentioned as an achievement in your management structure is these KUA advisory boards. So I'm trying to get to a point where why is that an advisory board, and why isn't some of your KUA parent representation on your board?
We do have KUA advisory boards and have had KUA advisory board members on the Turning Points board since we started IOC. Okay. So each KUA...
Is that a guarantee slot? Is that in writing?
It's a guaranteed slot. I actually believe it is in writing. So we have 1 person from each of the advisory boards that sits on the Turning Points voting board of directors.
Of your 18 members?
Yes.
Okay, and how is that person selected from the advisory board?
They're elected by the members of the Community Advisory Board to serve. When they elect their officers, they also elect their representative to the Turning Points Board.
Okay, so all of that is written. I'd be interested.
It's a guideline that DHS enforces.
It's a guideline that DHS enforces?
Yeah.
So other advisory boards have representation on KUA boards? Look at Shapiro, she can't take it.
Other advisory boards?
All right, no, I'd like to see some of that. If you could submit that to the board for the folks over at DHS. I found that interesting, and I just wanted to see around governance. I believe in client governance and ability, so I found that interesting in your piece. One of the challenges that I've always had with this is the geography. How are you adjusting to the different neighborhoods spread out in this 4 KUA situation? I know you talked about bringing some of the back office stuff together and bringing some of the teams together. What if any challenges on the geography have you faced?
Well, given the neighborhoods that we cover, some geographies work well together. So for instance, KUA 9 represents all of West Philadelphia. So Those territories happen to be side by side, so it makes service coordination and outreach much easier. Although, you know, there are communities in Southwest Philadelphia that look very different than communities closer to City Avenue in West Philadelphia. One of the ways that we try to provide some autonomy to staff is we use our prevention teams to help provide insight on how we should be conducting outreach in each of the communities, recognizing that the fabric of those communities are different. We have had conversations about creating some overarching core goals for our CUAs and our prevention work, and then giving our staff the flexibility to leverage their community connections to make sure we uphold them. But I mean, it's definitely a challenge in terms of how we work with each of our stakeholders in each community.
Do you see a scenario whereby if the geography lines were changed, that would be too complicated for you to manage?
It's not something that we've really thought about, to be honest. We work closely with community organizations in all of our neighborhoods, and recognizing that, you know, Lower Northeast sits on the heels of Kensington. And so we're always partnering with organizations that really span oftentimes those community boundaries. So it hasn't been a barrier for us up to this time. I mean, all of the CUA CEOs, we meet regularly independent of DHS. So if there's ever a question or concern about how to handle a case-related matter, we would just reach out to our peer in the other geography.
So speak to us around the school placement issue. What have been some of the challenges, if anything, around school placement? I know we try to give particularly the older kids choice, but how do you manage that around that, right? If the placement is different, then...
Let me see, that would be...
We work closely with the Education Support Center, DHS, on those questions. The default position is that the child will remain in the school that they were in when they were referred to us, unless there's some other practical reason why that doesn't work. The decision on where to place the child is made in concert with, it's not really made by the CUA, it's made by DHS and the school district as they evaluate the particular needs of that particular child.
So we're transporting, and do we end up transporting
But we do transport children, we transport children long distances sometimes.
Mm-hmm. Is that by bus, private?
Initially, usually the CUA has to provide the transportation. It takes a couple of weeks for the school district to arrange transportation.
Okay, all right. I think that's it for me. Thank you so very much. I know you have a difficult personal situation and you're still here. Appreciate you coming.
Thank you.
Thank you so much. Okay, if there's no more questions from the members of council, thank you very much for being here and for your testimony. And if we can have the clerk call up the next panel, panel 3.
Donella Shaffer, Chief Child Advocacy Unit, Defender Association of Philadelphia, and Frank Cervone, Executive Director, Support Center for Family Advocates.
Good afternoon.
Good afternoon.
Please state your name for the record and begin your testimony.
I don't think it's on. There, we got it. My name is Donella Shaffer. I'm the Chief of the Child Advocacy Unit at the Defender Association of Philadelphia.
Can we also ask if it's possible, because we know we've been here for quite some time, if we could have you abbreviate your testimony, because we do have the written record. So if we could have you just go over some of the points in your testimony.
Yes,
instead of reading the whole thing. Thank you.
No problem. First of all, if I can just give a moment of background, however, which is that as the Chief of the Child Advocacy Unit, I did appear in front of this committee also in 2014 when there was some initial discussion about what was the implementation process for IOC and how were the initial CUAs doing. At that time, we did raise some issues regarding the case managers and their preparedness for court, not knowing underlying facts of single case plans, and therefore there being an issue with what needed to be addressed to reunify the family or to make a permanency plan for our clients. I would suggest to you that as I appear here 3 years later, that many of these same issues have faced us and continue to face us on a daily basis, and that we have consistently addressed those concerns to DHS leadership. I would say to you that we have been very pleased in the fact that in some of those instances and regarding some of those systemic issues, Commissioner Figueroa has heard our concerns, specifically in terms of issues which I think she previously referenced, that they have brought back to DHS the financial issue regarding payment of foster parents and kinship parents, which has been a major issue for us in terms of assuring that people who take our clients in are being appropriately financed to make sure that they have the appropriate resources for our clients and to ensure that families can receive the appropriate services. Similarly, we have spoken extensively with the Commissioner's office and with her leadership team regarding the issues of CUAs not being able to identify appropriate placements within their systems. And again, thankfully, DHS has heard that. They've reinstituted their CRU system, and now those things have changed and have gone back to DHS. In light of that, that has been extremely helpful to us. We are still, however, concerned about the fact that it is those same CUA workers who are making the referrals. So sometimes those things still take a while to get done. They still take a while to get back to DHS. And we also have some concerns about information and the accuracy of that information and the completeness of the information that's provided. I would also say to you that my office, although we did not represent Danielle Kelly, we represented her siblings when the department filed a petition after her tragic death. So we witnessed actually what those children went through as they processed their sister's death, and we learned firsthand some of the things that could have occurred that didn't. So I will say to you, as I appear here today and as we work every day in our office, Danielle Kelly and her sisters sit on our shoulders every day. We're aware of them. We're very aware that one child had a major impact on the system, which is why it's so important to us to always talk about one child. Every child makes a difference. So I know we've talked a lot today about generalities, but one of the things that we wanted to bring to you was give a face to some of these domains that you've heard about. It is with a very heavy heart that we looked at the data that DHS released regarding the CUA cases, realizing that when you aggregate the number of cases that were reviewed, which by my poor math skills was 7,931. Well, of those 7,931 CUA cases, 5,574 of those cases are being handled by agencies that were deemed by the DHS scorecard to be unsatisfactory, and that the remaining 2,356 cases were assigned to agencies that were deemed to be competent at the time. Again, one child makes a difference, and it's important to us to know that here are 5,000 children, many of whom we represent, where we need to be clear about what exactly needs to be done for them. The permanency domain that is been identified is certainly one plan, one case manager, which we think is incredibly important. However, we have learned the CUA system is somewhat fragmented. It's very splintered. I think that Councilman Green originally talked about being coordination of communication between systems. There needs to be a coordination and a communication within the CUA agency itself, Councilman. Those workers are sometimes working in silos, and we hear that the case aide might have one piece of information, the well-being specialist might have another piece of information, the visitation coach might have a piece of information. That information is not all being brought together in a way that's always a coordinated effort, as you referred to regarding the systems. We have instances which obviously you have all read, and I've given you individual cases because we think it's important for you to have a face of them, where workers have come to court to testify about a visitation coach and stopping the visitation case that they had, and that the mother had not been offered ongoing visitation because her visitation case had been closed. That's not correct. Her visitation case was never closed. But that's how the workers think about it, in silos, that these situations occur in that way. That is not correct. We've had situations where case aides do not understand their full role. And in one instance recently, which was very concerning, the case aide did not recognize that as a mandated reporter, she should have been notifying the hotline, the state hotline, that there was possible abuse that was occurring in a placement agency. But she didn't do it. Her role was, as she saw it, to note that in her file and to then let the case manager at some point later take over and decide what should be done. Again, that's exactly what is not helpful in these cases. The safety domain is the one that is most alarming to us in many ways because child safety is at the heart of why we are here. Danielle Kelly died because social workers who were supposed to be seeing her and monitoring her safety and well-being totally failed to do so. Alarmingly, we have experienced multiple instances where that exact same failure has occurred. I know that all of you are aware, as we were, the newspaper articles in the Inquirer regarding 7 COA workers who were fired because they had falsified documentation. During 2017, we had instances of 8 COA workers who were involved with at least 25 of our children documenting falsified visits in their files and testifying to visits in court that did not happen. That's exactly what happened with Danielle Kelly. So again, these case managers might have been fired from their positions, but again, we still have those situations occurring. We also have significant questions regarding the quality of the safety visits that do occur. And again, it's because of our situation with Danielle Kelly. We know that one of the situations that occurred there was that workers did not go into the house. They really didn't go in and see what was going on. We have workers right now who we know do not go into the home. They do not leave the area where they actually go in. They don't know at this point where the child sleeps, what the child's bedroom looks like, what the condition of the rest of the home is, if there's appropriate food, or even who's residing in the house. It defies good social work practice, and in all honesty, just good common sense that people need to go in the door and see what is occurring for children and what is happening in that house. That's what did not happen with Danielle. No one walked in the door and opened the door to her bedroom and looked in to see what was happening. These examples for us are eerily reminiscent of the Danielle Kelly case and the needless horror of her death. Case planning continues to be an ongoing issue for us. We have had numerous situations occur where case managers do not know the underlying facts of cases, and as a result, they do not include what is necessary in their single case plans. Additionally, there have been instances where judges and hearing officers have removed COA from the cases and have sent those cases back to DHS because of the inadequacies of the COA practice. The court practice domain continues to be an ongoing issue, and I think Councilman Gwynn raised an excellent point when she said that we need to have COA workers who are better about being in court, and I can appreciate the court situation. However, we just simply want them to show up sometimes, because in reality, what we have is a recent incident where we had 9 COA workers who failed to appear on their court case on one list. None of those cases moved forward that day. It's not fair to the child, it's not fair to the family. Permanency does not move forward if people don't appear in court. Permanency does not occur if you wait 2 hours for a COA worker who does not check in with a courtroom, has never appeared, who does not submit a court report, who when her phone is called does not answer her phone, the supervisor is not able to be contacted, and when the DHS court representative who was there contacted the agency said they had no way to get a hold of them. Again, cases do not move forward if people do not appear in court for us to be able to move cases forward. I appreciate the fact that there's going to be a lot of training about court procedure, but until we can get them actually in the room, training about court procedure doesn't really help us. The supervision practice domain is probably one of the major issues, and if this domain actually goes to the quality of the supervision and the services that the agencies are providing, then I suggest that it is one of the most important domains. Services being provided to our clients is an enormous issue to us. We experienced a situation last week where a COA worker notified us via email that the kinship provider was unable to take our client to her therapy appointment, her trauma therapy appointment, and suggested that perhaps we could stop the child's trauma therapy for a period of time until the kinship provider was able to do that, and wanted to know if that would make the kinship provider in noncompliance. In reality, that wasn't our issue. Our issue was this child needs to get to trauma therapy. She has suffered sexual and physical abuse. She needs to be in trauma therapy. The COA worker's next suggestion was perhaps we could put the child on an Uber and have the child be transported back and forth to therapy via Uber. In what world do we put a 7-year-old child in an Uber to send her to trauma therapy and then expect her to get back on the Uber to go back to her foster home? If anything, at the end of the trauma therapy, she needs a hug and not an Uber driver. is that truly the value that we give to these children's lives, and what more can we do to provide them the services that they need? The assessments, health, education domain is also an issue for us. We're not quite sure why people cannot be filling out forms and getting our children connected up to the correct primary care physician. That seems to be an ongoing problem. School workers don't seem to know how to utilize that well-being specialist that they've got right there within their agency. And again, staff turnover continues to be an issue for us. Councilman Greenlee, you raised the issue that we in our recommendations had suggested that the DHS adoptions unit adoption should go back to DHS, and when you posed it to the commissioner, she said that they would not be in agreement with that because of the permanency issue. I think we're talking about two different scenarios. We are talking about cases where parental rights have already been terminated, not leading up to that permanency, but where parental rights are already terminated. We have situations right now where we have children who are free for adoption, and we cannot move them through the system. It has stalled. We have 1,700 cases in a courtroom right now that is ironically enough called the Accelerated Adoption Review Court. There is nothing accelerated about it. School workers do not have a good understanding of how to make the adoption process work. In addition to all the other people at their agencies, they also are faced with the fact that they have family profile writers that they have to talk to, child profile writers that they need to talk to, individuals from the statewide adoption network. There's a DHS permanency worker involved. The case moves around them, not because of them. And that's a problem. So we are suggesting that just as DHS took back central referral and just as DHS took back payment issues for kinship, that might be a way of dealing with that piece of the puzzle. They have said that they are working on that, but again, in the meantime, we have families who are waiting for extensive periods of time, months. By some of their own estimates, the adoption process has extended 6 to 9 months because we can't move things through with the CUA system. So we would suggest that, and in fact, right now, they do have DHS permanency workers who are on those cases, so those workers could assume the responsibility for at least managing that part of the process. CUA can remain involved, but there needs to be a manager who understands the system and who understands it well enough to move it. We also are very clear in our recommendations that we think there need to be much more focus on a development of medical and therapeutic foster homes. We lost a significant amount of those resources when the CUA system was implemented because many of those agencies were smaller, they went out of business, and they've never been recreated. We have clients who are waiting to go into those type of homes on a daily basis. Additionally, we clearly feel the need that the CUA supervisory level needs to be bolstered and trained more. It's been our experience that many CUA workers don't have a good supervisory support because that supervisory system in some way is just lacking. The supervisors don't really understand the nuts and bolts of what occur. Frankly, right now it's so splintered with there being a practice coach, a visitation coach, a DRO coach who says this is what the court ordered at the last time. That's in many cases what the supervisors should be doing, and we would suggest that that should be a major focus because supervisors should be able to step in when a worker's not there and deal with an issue. Too frequently we hear, the social worker's not here, I can't do this as the supervisor, you'll need to wait until the CUA case manager returns. Children can't wait, families can't wait. They need answers now, they need action now. So we would again ask that those things be done. We also made a request in our suggestion here in our notes that there should be Spanish-speaking staff on call at each CUA agency. I would agree with Councilwoman Jim that we should actually increase that, and there should certainly be a multitude of languages available. It's a disservice to our clients and to their families when we are trying to deal with agencies that do not have on-call Spanish-speaking workers at a time when a family's in crisis. If a worker's out there at 8 or 9 o'clock at night and nobody speaks English, and that worker doesn't, it doesn't help anyone in this situation. So those are some of our major recommendations. I would say to you again that 3 years ago, we informed this very committee in this very room that our experience with the CUA system and that it was replete with problems and issues. We implored you at that point to ask DHS to hit the pause button and to help us all take a look at what we should do then to make changes. Now we have a scorecard, which the commissioner says gives us a baseline, and I'm happy to know we have a baseline moving forward. I'm sad to know that it's taken us 3 years to get to the baseline. I hope that there are ongoing evaluations that are done to show where we have moved forward. But again, today, I'm pleading with you to intervene and to assist in making some of these changes and take the actions as needed, because very frankly, the families and children of Philadelphia deserve better. We owe it to them. And we owe it to Danielle Kelly's memory. Everyone talks about her, but it's time to make sure that there's not another Danielle Kelly. And very frankly, we have had deaths since the COA system has occurred, and we've had Danielle Kellys, and it's time to do something to make sure that it doesn't affect one more child. So that is our plea to you. And I would like to take any questions that you would have for me at this time.
Well, thank you very much for your testimony, and I was alerted to part of your comments while I stepped out in reference to a child taking an Uber.
Yes.
And I think a 7-year-old.
Seven-year-old.
Yes.
She was going to be going to her therapeutic, to her trauma therapy, which is located at Children's Crisis Treatment Center on Delaware Avenue across the street from the casino. And so the thought was that we could put her in an Uber, let her go to her therapy, and then she could be transported back. That is frightening to me. In what world does anyone put a 7-year-old in an Uber? I mean, she walks out of the appointment. You can only imagine. She's just spent 30 to 45 minutes in a room dealing with the trauma of what brought her into care. You can envision her. She's walking out, her little shoulders are down, she's hurt. She probably needs somebody to put their arm around her. She's walking out the door, and you have to imagine what she sees as she's looking for the Uber driver who's going to take her back to her home. That's not an answer, Councilwoman. That's someone not recognizing her for who she is, which is a 7-year-old child.
Right.
She deserves better.
Yeah, it's terribly frightening. As the parent of an 8-year-old, the idea that someone would think it was okay to put my daughter into an Uber and to let her travel on her own. And so I guess, I would just say whoever was making that decision would, you put yourself in these situations. Would I do that if that was my child? And the answer across the board should be no. So, it's really terrifying that was even considered for any reason. It's completely unacceptable. Councilman Greenlee?
Thank you, Madam Chair. Quickly, because unfortunately I have to step out for a little bit, but Ms. Shaffer, I'm glad you made clear, because I think we were thinking along the same lines. With the adoption issue, I was talking about cases that really were not in the disputed category at this
Correct.
point. They were just going through the process. And I've heard, and again, I think we're going to hear from somebody that it seems like they're taking an inordinate amount of time. And now, does it seem to be, in your opinion, a lot of the problem is the changing in the CUA workers and all, or is it just normal court delay, which happens in all seems to happen in all court cases, combination of both, or?
In all honesty, I would say that there have been occasions when it's been court delay, but I would say the majority of cases are because of CUA workers not showing up to court, CUA workers not being prepared with information to be able to proceed. When you get a CUA worker who arrives at court and says, I've just been assigned to this case 3 weeks ago, and the first question that is proffered to them by the city solicitor who is sitting next to them is a question along the lines of, where does the child go to school? When that question can't be answered,
right.
One has to be concerned, because if anyone's ever talked to a kid, that as adults, we always try to figure out how do you make it easy. So we ask the question of, what's your name? How old are you? And then what's the next question we all ask? Where do you go to school? Who's your teacher's name? So when you think of it in that context, you have to wonder, what was the visit like that worker made to that home when that worker saw that child 3 or 4 days ago, that the worker can't answer the simple question of, where does the child go to school? So the turnover of workers is an ongoing problem, but also in the adoption field, and when we do adoption cases, there are a lot of moving parts. And I will say to you, someone asked earlier, is there any time when we would have looked at, was the older part the better? The DHS adoption unit was a phenomenal group of people, because you know why? You had to be a DHS worker for a long time. They knew the system, they understood the system, they knew how to make those pieces work well. That's not what's occurring right now, because KUA does not know how to manage those cases and move them in a way that propels the case forward to an adoption.
Yeah, unfortunately, we've heard some of the same issues, so, all right, thank you very much.
A question to the Commissioner. I was wondering if you would like to respond to Ms. Shaffer's testimony, if you had any response.
I think that Ms. Shaffer, as highlights a lot of things that are concerning and completely unacceptable to hear from as a commissioner. And I think what's critical and what we've been trying to highlight today is that we were in an absolute disrepair. To say that we're in the same place as three years ago is an absolute fallacy. I didn't take this job because I just wanted a really significant job in city government. I took this job because it was on the heels of the testimony of the 7 workers who had falsified, the fact that we had lost our license, the fact that we were struggling through reform. And I'm incredibly proud of the progress that we have made. Are where we need to be? Absolutely not. We have data that proves some of the things that she said are places we've made improvements. There are places we have not made enough improvements. Adoption is an excellent example that we have a long way to go. I wouldn't stay committed to this if I didn't think we were making progress. And certainly the items that get brought up, I mean, the 7-year-old story is the first time I'm hearing that. I have an 11-year-old, I have a 6-year-old. I would be mortified if I had heard that as well. So part of this, that Councilman Green around coordination and collaboration, means that we always have to hear the dirty, the ugly, the difficult. And I think one of the challenges that I ask a lot of our advocacy partners is for us to remain in constant communication. And we're very grateful that they bring these issues to our attention. And so I'm not going to hide behind it. We have a lot of work to do. We're not where we were 3 years ago. And I will look at some of the recommendations that made. I'm not sure that we will move to all of them. Ms. Shaffer didn't highlight anything that we haven't seen as a challenge for ourselves.
How about Ms. Shaffer's comments that prior to moving to this model, that the adoption unit was in much better shape in terms of the length of time? Because I know it was asked, I think it was Councilman Greenlee,
correct,
who asked about the length of time for adoptions. And, you know, we were told previously that this was an improvement.
Sure.
And so now we're hearing that this was not an improvement.
So our permanency is an improvement. The adoption issue, yes, we had an excellent adoptions unit. My reflection on it is that the evolution of this reform effort, and Ms. Shaffer is correct. We have workers who were just now getting to a retention point. We're getting workers who are better prepared. And the adoptions one area, I think similar to other challenges that we have faced, that my concern is about quickly shifting without allowing progress to happen could result, you know, in we don't have the adoptions unit right now. So if I bring it back, the question is how would we manage that? We'd be sort of in the same situation of hiring up. We have workers who have been highlighted here, so certainly can enhance. So I think it's a dialogue that we need to go back and look at in terms of the adoption issue.
Okay, because as we are sort of experimenting with some of these things, and like I said early on, I recognize that this is not easy, that there's no quick and easy fix here. These are very difficult circumstances that we find ourselves in terms of caring for these young folks who desperately need us.
Yep.
But while we're trying to figure it out, you know, they're growing, they're having experiences, things are happening, life goes on, and, you know, in some cases, we're not there.
Yeah.
And so, again, I'm not trying to beat you up about it, but just recognizing that, you know, life moves on while we're trying to figure out what's best for these young people.
Yeah, and I think I'm happy to be here because part of owning our ability to move forward is the willingness to hear all the difficult information and recognize where our greatest challenges are and put as much time and energy into those areas. In terms of our evolution, I think we've really prioritized things that were impacting practice. If your caseload size are super high, you have to bring those down. If we're killing the amount of investigations that the workers are getting because there's just overwhelming. So we've made a gradual impact on that, which ultimately we hope continues to improve progress.
Okay. Mr. Servone, would you like to state your name formally for the record and begin your testimony?
Thank you. I'm Frank Servone. I'm the Executive Director of the Support Center for Child Advocates. Child Advocates is Philadelphia's pro bono lawyer program for abused and neglected children. Like Donnie Schaefer's office, we offer the skills and dedication of lawyer social worker teams to together work to represent each of our clients. Last year, we represented what was for us an all-time high of 1,100 children. For more than 40 years, we've served as a resource to this community and to this council, and I thank you for the invitation to serve in this role once again. And I will try to summarize as you've asked. We certainly want to recognize the substantial improvements in many important measures that have been noted today by various of your witnesses and by the several reports that are before council. There are other positive indicators we haven't talked about: the reduction in repeat abuse cases, the building out of DHS University, high quality forensic interviews at the Philadelphia Children's Alliance. As the Commissioner just referenced, there's a genuine commitment on the part of all of the leaders of this system to improve. I really have no doubt about that. And there's regular communication among DHS leadership, CUA and agency directors, other city agencies like CBH, the school district, and the DA's office, and with the advocacy community and with family court. Mostly, we all talk to each other. I find that tremendously healthy and a good sign. I'm a fan of IOC. Indeed, several of my colleagues and I were deeply involved in the planning process. I chaired the work group on data, performance management, and accountability, so I have a real affection for some of the topics today. The basic structure of having services and workforce located in and connected to the community remains a very good idea. I think we have to stop talking about the good old days. We didn't like them very much, I can tell you that, and get back and get on with realizing the promise of IOC. Let's get on with version 2.0, and a key feature is the CUA scorecard. I like the scorecard a lot, notwithstanding the chair's question. I don't have a problem with its methodology. I think it's a fairly sophisticated tool, and yet it's accessible. There's a lot behind the page that they're bringing to bear in putting those numbers on the page, and we can tinker with the dials, but it's a really good start. I commend Commissioner Figueroa and the Deputy Commissioners Shapiro and Lisa Rodriguez, whom you've heard today, and they're really their entire team, as well as the CUA directors. They have all been at the table with us, and even more with each other. And I know there's no punches pulled in that room. Accountability can be hard. It's so necessary. Transparency is essential in this world of ours in child welfare work that is often so secret. The child welfare system under IOC is considerably more transparent than any predecessor in Philadelphia. So that its strengths and its problems are now publicly known and discussed. We should all like that, even though it can be painful and uncomfortable at times. The scorecard demonstrates a troubling picture. There are 52 of 90 benchmarks that were rated as either unsatisfactory or critically problematic. And if the programs that DHS continues to run itself were added to the mix, that number of deficiencies really would have been even higher. These numbers demonstrate that the reform isn't done yet. And when work is below grade, children and families get hurt. In November of 2015, shortly after Mayor Kenny was elected, we prepared a 10-page summary memorandum titled Child Welfare and the Mayoral Transition, and I've attached that to the remarks that we've provided to the members. We noted that it was back then that it was difficult to determine whether the problems that practitioners and judges and others were seeing at the time were exceptional or normative. It was also new, and it was another time of transition. Now, more than 2 years later, as we review those 9 or 10 flags of concern that we put up, we can see that they all persist. First, we talk about safety. Making the decision about which children are really unsafe is the primary mission of any child welfare agency. It's one of the hardest decisions the system and its people have to make. Play it safe and be overprotective, the number of children removed from their homes skyrockets. Be patient and reluctant to act, a child gets hurt. Visitation, seeing a child in his or her home, was the single most important feature of the Child Welfare Panel recommendations and the IOC goals. You heard Donnie talk about it. Danielle Kelly died because no one saw her. This was the very first item of performance and monitoring from the Child Welfare Panel, with visitation data presented regularly to the COB, the Community Oversight Board, for at least 5 years. Yet in the scorecard for the year that ended June of 17, we see that 4 of 10 agencies were unsatisfactory with 2 bells, and the remaining 6 were only competent with 3 bells. The in-home safety assessment is a checklist kind of instrument. It's what structures this safety visit and this fundamental front-end question about whether the child's safe or unsafe. Yet inside the casework that we do, it's unclear how the results of these assessments are utilized by the COA team. Are they dynamic documents that are used to guide service planning the way they were designed to be, or have they become a form that once completed is never used again? The complex cases are particularly challenging for many COAs and their staff because they pose heightened safety questions. Whether it's behavioral health or the dynamics of sexual abuse in families, too many COA workers are either not seeing the important details or don't know what to do with the information. We need more COA staff with specialized knowledge of family dynamics and other issues in these complex cases. Family permanency. While the permanency rate has improved in the last 2 years, it was coming from a very low bottom. The adoption process was poorly implemented with IOC, and those problems continue. You just heard reference to a lot of them. Count of days is the currency in work with children. In this work, it couldn't be more straight line. Count the number of days from TPR, the termination decision, to finalization. The court says you're adopted. That count of days remains large, way too high. We have always been the slowest adoption process in the entire state, but for the last 5 years, it's been even worse. I'd like to tell you that it's getting better, but there's really no indication of that. What is damaging is the erosion of the confidence and commitment of the family to the child and the child's own sense that this is the home I'm going to stay in. Things break down when they take too long. Thankfully, we can count success stories, many of them in this permanency category. Even the delayed adoption that finally gets done is a successful outcome, but a stay in care for 48 months is not. Likewise, the child returned home after too many months in care can be counted as a positive permanency outcome, but at what emotional cost to that child living without his or her parents? We've talked about transition delays and problems. The early stage handoff of the case is really problematic, and I just thought I'd offer the example outside of our field of the hospitals that we have all experienced for ourselves and our families. Think about it. Every shift change, every day, is punctuated with a crosstalk between the 2 nurses, the one going off and the one coming on, right? They're handing off information. Why? Because information matters. We should be able to do that. Meeting scheduling concerns. You would just think this is just small potatoes, right? right? You can't get your meetings straight. IOC features a host of interagency and family meetings. It's a foundational aspect or element of most reform initiatives. Scheduling an invitation to meetings continues to be annoyingly problematic. Meetings are not scheduled or located at places and times that are convenient for working parents or school-age children. The participation of parents and children seems not to be the priority it should be. It was one of the metrics we recommended from the beginning and they should be reporting on for their own well-being. A typical exchange my own staff said goes like this: my client needs to be involved in the meeting. Well, the only time we have available is 11 a.m., so I guess she'll just have to miss school. Whatever one might say about the complexity of the cases or the size of the caseload, they should at least be able to get their phones, their invitations, and their calendars right. The CUA workforce, like every child workforce in this business, is a noble force, right? You're inviting people to take on the hardest work that the community has to offer, right? We did not do it well. Everyone agrees that the IOC created an entirely new workforce of case managers and that it didn't go well at the beginning. But 5 years in, many cases are still experiencing significant turnover within the team assigned to a particular family. Staff turnover and the assignment of inexperienced workers create gaps in information sharing and the completion of tasks. The quality of practice remains spotty. There's some solid practice and there's some really bad practice. Skills development, training, and supervision should be the answer, yet performance problems abound. The use of electronic case records should make information accessible, but instead information is too often not available or not used. Institutional memory matters. When I go for my annual physical, my doctor always remembers to ask me if I'm still swimming. She remembers my mother had 2 types of cancer. She checks me head to toe for skin moles because she took one off 15 years ago. That's what they remember, right? In our work, it might be the person's trauma history or what allergies the child has and what medications are supposed to arrive when she gets there.
Mr. Cerrone, I'm going to ask you to summarize because we're going to lose our stenographer in a few moments. So if we
Okay,
could...
I'll be very quick and I'll
Okay.
get to my 4 recommendations.
Okay.
Continue to compile and publish the CUA scorecard, but grow it and add measures for DHS's own practice and for the many other measures that have been identified. It's a great start. There are dozens of others identifying the design of IOC that should be unveiled. Second, improve practice in meaningful ways and measure it. Classroom learning that's pursued in the Charting the Course program for new CUA workers is necessary. It's simply not sufficient. The practice coaches and case supervision folks inside the CUAs have to get stronger. Nurses need to be more available. We need to place real-time data in the hands of the CUA staff on the ground. Information must be available to support decision-making. And finally, I repeat, actually I didn't get to say it the first time, we must be impatient with the pace of change. We must move beyond compliance through proficiency and into excellence. From the date of the settlement of the Baby Neal litigation in 1999, we spent almost 20 years getting to a C- or a D+. What will the new schedule of a high-performing agency be? We need to get on with that new time clock. Thank you.
Thank you so much for your testimony, and I agree with you, and I'm going to use your line again. You'll hear that again, that we have to be impatient with the pace of change, that this is not the change that we should be having, and it really feels like a bit of an experiment on our young people while we're trying to figure out what to do, and we don't have any time to waste. So, but thank you very much for both of you coming in, your testimony, and greatly appreciate it and look forward to working with you in the future.
Thank you.
And if we could have the clerk call the last speakers to testify.
Casey Caramanica, Nadirah Collins, Shakia Rambert, and Tawana Sabbath with the Alliance of Black Social Workers.
Okay, and this is our final panel. And we also have written testimony from Ms. Reagan Kelly, the Chief Executive Officer of Net Community Care. We are going to ask, in the interest of time, that if we could summarize and maybe give us 2 minutes, if you could summarize in 2 minutes your testimony, we would greatly appreciate that. Okay, you can state your name for the record and begin your testimony.
Yes, I'm Dr. Tawana Ford Sabbath, and I'm representing the Alliance of Black Social Workers, which is the Philadelphia chapter of the National Association of Black Social Workers. And I am here for the second time, was here in 2016, and I commend you, Councilwoman Bass, for continuing and just making sure that we look at this situation in a fine-toothed way rather than skimming over. I'm going to pick up on one of the disadvantages, of course, of being last is that everybody said what I wanted to say. So I'm not going to repeat, but I am going to try to raise some points that concern me. One is that when we were here the last time in 2016, the fact that the turnover rate was so high is still a problem. And I know as we have looked through the Bell system of grading, yes, I was very concerned that much more emphasis was still placed on safety, and we know that that is important, but that safety is also dependent upon the quality of the workers that are involved and the way that the system trains those workers, holds them accountable, supervises them, and then, of course, the way that they have to report. As I've listened to the testimonies, one of the concerns, of course, is that the volume of work that has to be done by the case managers is unbelievable and unmanageable and impossible. I have not heard any way of reducing that or changing that to a point that one human being can do all the things that have been cited. So that as far as we're concerned as social workers, there has to be some level of assessment of what is humanly possible and what is definitely in the benefit of the children and families. Also, as we looked at the weighting system that was used for the different categories, there was so little placed on the case planning. And so that becomes extremely important as the case progress is reviewed. I also understand from one of our members who serves as a DHS practice specialist at ACUA that our earlier concerns about an adversarial relationship between the ACUA staff and the DHS resource persons has improved. That's a good thing. However, I was also informed that there is consideration of decreasing the presence of the DHS team coordinator at the CUAs. That person is responsible for making certain that contact is made with all persons and entities involved in a case so that the team meeting for developing and reviewing the single case plans will be effective. The work of the practice specialist inside, so to speak, and that of the team leader sort of on the outside seem to complement one another. If the practice specialist has to attend to the internal workings of a case, as well as assembling all parties for the meetings, work with the agency staff will suffer. We're also questioning whether the CUA staff members are reflective of the communities that they serve, and that point was raised earlier, and I just wanted to reiterate it, because we know that staffing should be a key point of attention because of the community-based approach. Then, in terms of the community managers, the case manager's relationship with families, as has been cited before, because of the retention and or lack of retention and the massive overturn, the relationships that are developed are so key because of the sensitivity of the situations that come before the workers. And when those workers are transferred, as we've looked at, they move away, there's not that communication between, and then there's some lack of continuity. There's also something that came up to me, and I really didn't know what to do about it, but that is that the financial concern or financial management is so low in terms of the percentage that was placed there, and I know I couldn't figure out why that was the case. And then finally, the 30-day improvement plan that was listed in the report. I'd be interested in seeing what happened with that. We heard some of that, but it wasn't clear enough for me to see how then those CUAs that seem to me should be moving out of the system are still held in. There's also the idea of peer mentoring between or among the CUAs, and that sounds like a good idea, except that with all of them being so low in scoring, I'm not sure that the mentoring is something that will help or to improve. And I'm going to leave it at that.
Well, thank you so much for your testimony, and good to see you again. And
yes.
I do want to add that a lot of your questions, I just want to alert the commissioner, we'll be asking these questions at budget time, so which is like almost tomorrow. So so soon we will be asking you these very same questions, and we really hope that, well, I'm sure that you'll come prepared with those answers. Thank you so much. Okay, if we can have you state your name for the record and begin your testimony. If we could have you abbreviate it in 2 minutes.
My name is Casey Caramanica, and I adopted a child through DHS, and we were assigned the CUA of Tabor Community Partners. I will outline the most striking examples of the ineffectiveness and incompetency that we have dealt with since December 2015. Our son was placed in our care on December 4th, 2015. We met with our DHS caseworker, Kim Hightower, once after leaving Temple University Hospital with our son. This is the only time we ever met with her or received responses to any questions we had for her. We were already in the process of adopting when this placement occurred. We had our criminal and child care clearances. We had a family profile completed. When this information was offered to Ms. Hightower, it was refused. Our initial CUA caseworker was Shanina Carter. Ms. Carter missed or rescheduled every single appointment we had with her, most of the time without bothering to call or notify us that she would not be coming for her visit. When she did show up on each visit, we attempted to provide her with our financial information, clearances, and family profile, and each time she refused. Ms. Carter was the first of 4 caseworkers we would be assigned through Tabor Community Partners. In March 2016, we received a notice that we were to attend prudent parenting classes 1 week later at Tabor Services. My husband and I were unable to reschedule work commitments and told the CUA worker, Mr. Lorenzo, that we would not be able to attend. He was understanding and rescheduled our classes for June. We believed everything was fine until May 19th, 2016, when we got a letter from Donique Bell, the director of Philadelphia programs, stating our child would be removed from our home immediately due to the failure to attend the prudent parenting classes and missing paperwork, which we had offered them many times. With no answer from our caseworker, no answer at Tabor Community Partners, and no answers from our child advocate, Mr. Lee Coleman, we immediately drove to Tabor Services, where we were told to ignore the notice, that our caseworker quit several months prior with no notice, and that we again would be given a new caseworker. We attended the classes in June. Donique Bell was there, but she was again unable to accept our paperwork or meet with us. Thankfully, we were able to provide the child with medical insurance through an employer. We received no medical information from Tabor Community Partners until after our adoption was finalized, after almost 2 years. We also had no birth certificate or social security number. We ourselves went to the city's vital records department for his birth certificate because no one at Tabor or DHS had the ability to obtain it for us. Even as of today, to our knowledge, the child's case is still unclosed through DHS, even though the adoption is finalized. We remain unable to change his social security number and name on his Medicaid information. I hope you will work to make the system run with more efficiency, oversight, and compassion so that more families do not have to go through what we faced. It is important for me to make clear that we are a stable family with good incomes, and we were able to provide medical coverage and attend the many court cases. We endured months of missed and rescheduled home visits, threats of taking our child away from us, and we were able to tolerate a lot and fight for this child. But what about the families that cannot? What happens to those children? Those children are sadly in grave danger in the care of CUA and DHS services. Thank you for the opportunity to provide testimony here today.
Well, I want to thank you for being here for this really powerful testimony.
Thanks.
Because this really speaks to exactly what it is that we're trying to fix. And once again, Commissioner, we really want to have answers. We're going to give you some time to do some research, but when we get back together, when we connect again during budget hearings, we really would like to hear an explanation as to how this happened, and importantly, what's happening to make sure it doesn't continue to occur in the future. Because as Ms. Caramanica, as Ms. Caramanica stated, they have a stable home and decent incomes and jobs and that would allow them to take time when they were able to. And so, but what about those who do not have this level of stability, but who really do want to be involved and care for a child, and have become attached to that child? The threat of someone coming in and taking away your child is beyond frightening, for anyone, whether you're in an adoption process or whether you live at home with your child that you gave birth to. It doesn't matter. The idea that someone could come in and threaten you with such action is deeply troubling. So we really do expect to have some answers, and I'm sure you'll be prepared at the budget hearings in the next couple of weeks. And so for our last speaker,
Good morning.
Ms. Collins.
Well, good afternoon, Ms. Rambert.
Ms.
Shakia Rambert.
Rambert, okay.
Yes, ma'am.
Thank you so much for being
I'm
here.
Shakia Rambert, and I'm a resource parent for Second Chance Incorporated. I was asked to be here today to tell you my story with CUA and my experience with CUA. About 3 years ago, I was preparing my home for a pre-adoptive kinship placement, and it's, a placement just of someone that I knew, but just in case the child needed to be adopted, I would be available for this child. Shortly after completing my certification process, I received a phone call from a Second Chance Incorporated, Mr. Alexander, asking if I would like to accept a respite, which is in a temporary home for a 2-year-old child. He expressed that this would be an awesome opportunity for me, preparing me to become a full-time parent. Kind of like to get my feet wet. I accepted. A few hours later, Sair, at 2 years old, was placed with me. The first few weeks was really rough because I was learning how to tackle working and going to school and caring for this child. But was more so challenging because I had a 2-year-old that did not talk to me. He would point, he would cry, he would throw temper tantrums, typical normal 2-year-old stuff. But when I would see him interact with other children, I noticed that he wasn't meeting certain milestones that the children that he was, playing with, interacting with. On Sair's 3rd birthday, he was diagnosed with profound hearing loss. Sair was deaf. Catherine Kelly, CUA case manager for Turning Points for Children, was assigned to our case. Although she was fairly new to CUA, and CUA is in itself being fairly new, that didn't matter to me. I was very, and even being aware of how busy a CUA case manager can be, it didn't stop me from calling her frequently and being the not so easy to please resource parent and very insistent. I can say Catherine Kelly if not answered my call, she called me back within a matter of minutes. She was very attentive. I'm sorry, I'm trying not to get emotional.
It's okay.
She advocated for Zaire. She made sure the courts were aware of the services and the resources that he needed, and that CUA and DHS both provided those services for him. Most importantly, with her great power of patience, she provided support to not only Zaire, but to his biological mother, siblings, thank you, siblings, and for myself. Her great power of patience helped me along the way. And when things went wrong, she found a way to fix them. Although over the summer, Zaire had a cochlear implant placed, one cochlear implant placed, allowing him access to sound, to be able to hear. He is a candidate for bilateral. However, as a team effort with Ms. Kelly and others, we decided that, allowing Zaire to make that decision on his own later on in life. Because at this time, we weren't sure where we were going in terms of placement and so forth. Zaire now attends one of the best schools in the country. And maybe, I'm not sure, don't quote me on this, but I know a few years ago it was the #1 school on the East Coast, which is Clark for Hearing and Speech, where he receives services 5 days a week throughout the day, throughout his school day. Every day, Zaire would come home and he would say something, and amazed me, because it went from a child that I had no idea what his future, our future, held, whether he was going to be reunified or however. It amazed me that he had progressed so much with the help of Ms. Kelly advocating for him. On the 24th of January, this past month, we celebrated the finalization of Zaire's case and Ms. Kelly walking that walk with Zaire. Now my son, a dream come true. Not the dream that was planned, but it was, it was a greater being that had another plan for me. Ms. Kelly was exceptional. She was beyond exceptional. Not just Ms. Kelly, but her whole team at Turning Points for Children were beyond exceptional. They displayed what I call how working together makes the dream work. And in conclusion, although my story is totally different from yours, I would like to share with you something that I learned and now understand. When someone said, if you want to go fast, go alone, but if you want to go far, go together. Yes. And knowing that it takes a village to raise a child, I'm happy to say that Catherine Kelly was a part of my village and caring for Zaire. Thank you.
Wow. Well, thank you. Thank you. Well, I almost have members of council about to cry up here. That's really, your stories are really touching, and I think hearing from you through all the academic conversation that we go through, for all of the data points that we're looking at, this is where the rubber meets the road. This is what it's really all about. And I really want to applaud you, as a parent. I applaud you for fighting for your kids, and these are all of our kids, whether you gave birth to them, whether you adopted them, these are all our kids, whether you just see them on the street. And so I just really want to thank you for all that you've done. I want to thank all of the providers for all of the work that they've done. And we want to know, listen, we don't want to come here just to beat up on folks. We want to know who's doing what right, what's right and what's not right, so that we can fix it and make it right for all kids. So I just really want to thank everyone for being here today. I believe that concludes our testimony. Was there anyone else here to testify? Okay, seeing none. That concludes today's hearing.
I just want to make a comment.
Oh, I'm sorry. Councilman Toggenberger did want to make a closing comment.
Thank you, Councilwoman Bass, as chair lady of this committee. Thank you for your leadership on this subject and putting this resolution and this hearing together today. It's greatly appreciated. I want to thank all the folks that testified. I found it very, very enlightening and has given me some information going forward. Thank you all very much.
And again, thank you so much, everyone, for being here. Seeing that there's no one else here to testify regarding resolution number 170949, and there being no further business before the Committee on Public Health and Human Services today, the public hearing on resolution number 170949 is recessed until the call of the chair. Thank you very much for your attendance and your patience today. Thank you.